bertumbuh gagasan menepis kelam. Air mata bahagia semayang di Jakarta, rumah untuk semua. Memahami diri, berwarna-warni, kolaborasi. Tarakan bersama, Jakarta dibawa kemana, di hati segenap warga. Jakarta, oh Jakarta.
Kita tahu, dalam satu hari, sejak surya merekah perlahan hingga cahaya bulan menemani, dingin ibu kota terus berjalan dan tak pernah terhenti. Selalu saja ada aktivitas yang tercipta dan menghidupinya. Mulai dari kamu yang berkelana dengan sepeda, kamu yang sedang khawatir tertinggal bersekolah, kamu yang sedang berjalan menuju rumah, dan kamu dengan teman sejawat yang saling bertukar cerita tentang perjalanan hari ini. Meski waktu, tempat, dan rasa yang kita miliki berbeda serta beragam, selalu ada satu hal yang menemani kamu melewati itu semua. Berkolaborasi dengan ragam pihak, Plus Jakarta hadir dalam berbagai rupa dan warna untuk temani teman kolaborasi dalam tiap kegiatan. Karena Jakarta ingin kamu peka dan memantik kesadaran akan identitas kita bersama sebagai kota kolaborasi. Sudah temukan dan sebarkan Plus Jakarta di tempatmu?
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh, bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma.
Raffi, obat kolesterol mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat, terutama pada akhir pekan, seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kenchik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 31 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Dinantikan peran seluruh warga agar Jakarta nyaman buat segala. Air, udara, tanahnya mesti dirawat biar jadi berkah untuk penghuninya, isi buminya, cakrawalanya. Kreasi berkecambah, jiwa bergairah, ruang-ruang dicipta, pikiran terbuka. Budi baik mereka, hasilnya meruah, kota jadi berbunga, begitupun kita. Impian tentangnya wujudkan nyata, bertumbuh gagasan menepis kelam. Air mata bahagia semayang di Jakarta, rumah untuk semua. Memahami diri, berwarna-warni, kolaborasi. Tarakan bersama, Jakarta dibawa kemana, di hati segenap warga. Jakarta, oh Jakarta.
Kita tahu, dalam satu hari, sejak surya merekah perlahan hingga cahaya bulan menemani, dingin ibu kota terus berjalan dan tak pernah terhenti. Selalu saja ada aktivitas yang tercipta dan menghidupinya. Mulai dari kamu yang berkelana dengan sepeda, kamu yang sedang khawatir tertinggal bersekolah, kamu yang sedang berjalan menuju rumah, dan kamu dengan teman sejawat yang saling bertukar cerita tentang perjalanan hari ini. Meski waktu, tempat, dan rasa yang kita miliki berbeda serta beragam, selalu ada satu hal yang menemani kamu.
Hi, good afternoon. Welcome to the second day of plenary discussion Jakarta Investment Forum 2021, strengthening the post-pandemic economy through collaboration. This event is held virtually and is broadcasted through Pemprov DKI Jakarta YouTube channel, BI Jakarta YouTube channel, and also CNN Indonesia YouTube channel. And this event is also initiated by Department for Investment and Integrated One-Stop Services of DKI Jakarta and Jakarta Investment Center in collaboration with Bank Indonesia, Agung Sedayu Group, PT Bank Sentral Asia Tbk, Pakuwon Group, Putra Gaya Wahana, Roche Indonesia, and MRT Jakarta. An experience by Jakarta Experience Board. I am Dian Mirza. It's a great honor to moderate this panel. And today we have 3 sessions of panel discussion. The first one is about urban health. And next, we're going to talk about urban mobility, and the last one is about urban tourism in Jakarta. And before we start this discussion, please welcome Mr. Marullah Matali as the Provincial Secretary of Jakarta to make an opening remarks. Mr. Marullah, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us. Good afternoon, all panelists, speakers, investors, ladies and gentlemen. It is my pleasure to welcome you to the second day of Jakarta Investment Forum 2021. On behalf of Jakarta Capital City Government, I would like to convey my gratitude to our stakeholders for their tremendous support in organizing this event during the pandemic COVID-19. The year 2020 has presented us with major challenges from the global pandemic to economic recession. In the beginning of the pandemic, we saw it as a disruption to our city and communities. The impact great and experienced by many sectors. As Governor Anies Baswedan mentioned on the day one, that all collaborative action are needed in handling the pandemic, and it's come with good result. Today, the emergency status in Jakarta has been relaxed from level 2 to level 1. It is a great achievement for Jakarta in handling COVID-19. Ladies and gentlemen, as the highlight of today's agenda, we shall challenge ourselves to accelerate recovery program that focus on urban health, urban mobility, and urban tourism. First, on urban health, Jakarta took strong action by increasing testing and healthcare capacity through collaborative and innovative action. Our testing capacity exceeds WHO's guideline. We provide 98 referral hospitals and more than 5,000 isolation beds for COVID-19. Learning from this experience, Jakarta is keen to build a resilient health system in the future. Thus, the upcoming urban health session will highlight about health services, plan, system, and healthcare investment opportunities. Second, COVID-19 pandemic and climate change has forced the city to reconsider the relationship between mobility, urban space, and health in order to ensure physical distance while meeting the travel need of inhabitants. In this sense, Jakarta initiates a sustainable mobility through integrated transport system. Therefore, the urban mobility session would like to deliver a policy and investment opportunities for integrated public transport in Jakarta. The year 2021 is crucial for our effort to fight the pandemic and promote tourism recovery as well. To build resilient tourism in Jakarta, a shifting paradigm about the future tourism industry that lies on technology is needed. All these issues about urban tourism will be addressed on this last session. Distinguished ladies and gentlemen, by organizing Jakarta Investment Forum, I hope that JIF can be a platform to leverage any investment opportunities in tackling pandemic, boosting economy recovery, and paving the right path to make Jakarta as the global prominent investment city. We are looking forward to welcoming all the distinguished investors to participate in Jakarta growth. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Mr. Marullah Matali, for your opening speech. And next, we will start our first discussion, the future of urban health development in Jakarta. We basically will discuss about policies or actions taken by the DKI Jakarta provincial government, private parties in encouraging collaboration opportunities in the health sector, and recovery strategies related to the digitalization of health services. This topic is present in order to make the public easier to access the health services by adjusting the domestic health system to global trends. Through this opportunity, we will get explanations from several great speakers. And joining with us now by Zoom, all of our speakers. The first one is Mrs. Widya Stuti. Good afternoon, Ibu, as the head of Health Department of DKI Jakarta. And the next one we have Mr. Jonathan Sudarta as the CEO of Halodoc. Selamat siang, good afternoon. And then we have Mrs. Francisca Mardianingsih, MPH, as a WHO Indonesia National Professional Officer. And also later, Mr. Ahmed Hassan, as the Director of Roche Indonesia, will be joining us. All right, I invite each speaker to give a presentation for about 10 minutes. So therefore, please keep your explanation brief. And then after that, we will go to the question and answer session. I also would like to invite all of you joining us in this discussion to take part. If you have any questions, please type your question on the chat room box. All right, let's begin with the first presenter, Mrs. Widya Stuti. She'll talk about the overview of Jakarta health situation. Mrs. Widya Stuti, the floor is yours. Mr. Widya Stuti, the floor is yours.
Yeah.
Yeah.
Okay. Good afternoon, ladies and gentlemen, other distinguished speakers in the prestigious event. In my presentation, I will speak about the overview of Jakarta health situation and opportunities in Jakarta. Also, we use 3T plus strategy: testing, tracing, treatment, and vaccination, while also maintaining new habits. The strategy results in the flattening of the curve of COVID-19 cases. And we know that our case rate is below the WHO tolerant rates, where we are currently in 0.5% positivity rate in the last 2 months. We hope we can keep lowering the positivity rate. Even though the case number is lowering, we are still committed to maintain testing capacity in Jakarta. We also have mentioned that in tackling the pandemic, we use collaboration as a key point, which we collaborate with all sectors, such as central government, army, police, and private hospital and clinics. We also have 129 COVID-19 laboratories in Jakarta that support testing capacity. As for tracing, we appreciate that most people in Jakarta is cooperative with contact tracing process. In order to keep high performance of contact tracing and participation, we initiate to the collaboration of all sectors, community engagement, and local leaders to participate assertively. Besides close contact tracing, we also do the active case finding in some places and activity with higher rates of transmission. There are more than 190 hospitals in Jakarta, owned by government and private. We realized that the bed capacity was not sufficient to accommodate the high case of COVID-19 in the beginning of 2020. We learn and predict the trend to create many strategies to accommodate the bed capacity as needed for both isolation and ICU bed. We collaborate with the academic institution, research institution, and professional association to conduct the study regard to COVID-19 prediction and effective strategy. The result of the study can be implemented in health service modification, such as providing facility for maternity services using container. Some modifying facilities are also provide for dental procedure. We appreciate the central government who has taken the rapid action to initiate vaccination program since January 2021. We realize that Jakarta as the epicentrum has to carry out the program quickly. Therefore, we create strategy to reach the vaccination target as soon as possible. We use collaboration as strategy to create mobile vaccination to give better access for public to reach vaccination facility. So not only static vaccination, we also do mobile vaccination in public area, such as public transportation places, academic institution, office area, business center, and religious places. Not only about the location, we also pay attention to service time of vaccination, as we know that business activity in Jakarta happen in various time. So we provide the vaccination service from day to night. We hope to talk about the overview on how we handle COVID-19 using collaborative approach. Now we will talk about how we prepare the routine health services to address health problem in Jakarta through continuum of care approach. We create health program in the whole life cycle from the young to elderly. We use community-based strategy, be community empowerment, together with local volunteer and stakeholder. As we know that health problem cannot be solved in individual level only, but also in community level. That's why integrated health services is important. Other Jakarta governmental department also take part in providing public services that support healthy city, such as creating wider pedestrian sidewalk and sport festival in community level throughout the years. Experiencing from the past outbreak or pandemic such as SARS, avian flu, dengue, help us to develop better surveillance system from first level to highest level health authorities in Jakarta. We started to take action in mitigation the COVID-19 since the first week of January 2020 and consistently improving our system to detect, to respond, and to prevent future pandemic. Identifying hazard as natural hazard and man-made hazard, we develop information system to detect outbreak risk. We collaborate with other institutions such as meteorological agency to develop early warning system to predict danger pattern. We also develop emergency support system and COVID-19 information system that gather COVID-19 patient data from all health facilities in Jakarta and analyze into a dashboard to provide information for public, including hospital bed availability information. Collaboration is one of the biggest opportunity in Jakarta. During the pandemic, collaborative action led by the governor himself and the what we call Forkompinda, group of local government leaders consists of governor, Chief of Indonesia Police of Jakarta Area, Chief of Indonesia Army of Jakarta Area, and Head of Jakarta Attorney Office, with other pentahelic collaborators such as business owner, investor, NGO, media, academic and research institution, so remarkable partnership in combating COVID-19. And we believe that this model of collaboration can be replicated in future agenda. I will conclude my presentation. The last but not least, I once again invite you all to create your future and be part Jakarta Collaborative City. Thank you very much.
Mrs. Vidya Stuti for the presentations. Is very comprehensive and detailed. It's glad to know that government has some strategies and scenarios, just in case, even though the case number is lower, but there is a fear about the third wave coming, particularly maybe at the end of this year during the holiday time. And hope those strategies, one of them is collaborative actions you mentioned, can minimize the possibility of the third wave pandemic. Thank you very much once again, Mrs. Widya Stuti. We will get you back on the Q&A session. And next, ladies and gentlemen, also don't forget to book your one-on-one session with Jakarta policymakers in the Meet the Leader session on November 15th at 9 until 11 a.m. And our next presentation will be presented by Mr. Jonathan Sudarta, CEO of Halodoc. Mr. Jonathan will present about simplifying access to healthcare through technology. Mr. Jonathan, the floor is yours.
Thank you. Ibu Wid, how are you? Distinguished Ibu Wid. Ladies and gentlemen, just now we listened from a very distinguished speaker, Ibu Widya Stuti. I think Dr. Wid shows a real example of how public and private partnership is happening in Indonesia. What I'm going to share a little bit is just on some of the activities that we do during the pandemic, but also a lot of things that we actually do together with Dr. Wid in trying to overcome the issue of COVID in Indonesia. So if you kindly please go to the next slide. So just for those who, next slide. Yeah, for those who does not know about Halodoc, we are a telehealth company who try to simplify access for healthcare because of the current challenge that Indonesia possess. One of the key areas that is very notable is that we only have 3 doctors out of 10,000 population. That if you compare to many other countries in the world, I think we are in a position where we can improve a lot in this area. Hence, next slide. Together with many parts of the stakeholders in Indonesia, working very closely, we have this application who connect doctors, providers, also patients, and also payers. Next slide. This triangle of collaboration has one mission to simplify healthcare access. The manifestation of this triangulation goes into the next slide, which, if I can speak on this, what Halodoc has provide is a way to simplify access to healthcare for a patient to connect to doctors through their telemedicine. So within 15 seconds, they can talk to a doctor. They can get their medicine sent to them in their hand within 15 minutes. And also, if they need to go to hospital or they need to do tests and whatnot, which is what happened in the country during the period of COVID, it's actually all happening within the same platform. Next slide. So if you take a look at this, I think we one more click, please. It shows how the power of technology actually have overcome some of the key challenges that this country has with regards to access. As you know, cities of Jakarta, for example, has the biggest number of doctors and specialists, but by the existence of technology like telemedicine, we actually open access for people from all around Indonesia to have access to top doctors in big cities like Jakarta, for example. Next slide. So with this, basically, we give a very simple access for patients. In total, we have now about 20 million monthly active user that connected to Halodoc, in which they can speak to a doctor, they can do COVID tests, they can visit a hospital, they can get COVID vaccination easily in their hand. Now, the next slide exemplify how being a leading digital player in Indonesia become a very important tools during the pandemic. Dr. Wid shows just now about how we are collaborating together between the federal government, the cities of Jakarta, and this has a big impact on the existence of service like Halodoc. Next slide. It's not very common that healthcare application like Halodoc We actually surpassed a great company like Gojek, for example, during the period of COVID. We are actually the number 2 apps in the whole country of Indonesia with regards to downloads. This exemplifies how the needs actually meets the service that we provide. This only can happen because of good collaboration that we have between a private sector and also government sector, in which is being purely exemplified by the Jakarta government, the governor, the team, Dr. Wid championing a lot of that in many aspects that we do. I will share more on later part here. So I'll speak just very briefly about the future of health tech. I think a lot of research have been done by McKinsey, for example, that sees that there is a big interest on the upcoming telemedicine on the next years to come. Next slide. Also, it shows by the change of behavior during this period of COVID, how people are a lot more concerned about their healthcare. So not just about the telemedicine, but how they are a lot more caring for themselves. Transaction of vitamin that grow significantly shows an example of how people are actually care more about this. Next slide. Maybe we can go next 2 slides. I'll pass this. Next slide. Next slide. If we can go to next slide. One more. I think the main, next slide. I think the main parts that I want to share here is about how we are collaborating closely with the government. COVID-19 was a catalyst for Indonesia, a catalyst for Jakarta, a catalyst for telemedicine company like Halodoc to actually collaborate together for the better off of the population of Indonesia. We started the collaboration starting early 2019, where we provide a lot of information for patients, but also we work very closely with the government, federal and also local like Jakarta, to provide services of healthcare. I don't think there is anybody in the world that actually tried to manage COVID using telemedicine, but I think I'm proud to say that Indonesia actually doing that, and not just as a private company providing that service to send the medicine to the patients within minutes or hours, but the medicine itself is actually being paid by the government. So you can see that I think the government of Indonesia, whether it's the federal or the government or the local and the district, in this case, governor of Jakarta, I think they're trying to use a very, very pragmatic but also very innovative approach on using this. As you can see, during that peak of COVID, hospitals are full and whatnot. They basically try to look for this kind of solution. So I think I'm proud to say, and this is a great example how we collaborate together in solving one parts of market problem or patient problem by providing telemedicine that is supported directly by the government. On this case is the medicine. Next slide. It's another example of how we collaborate. Next slide. Yeah, how we collaborate closely with the government on providing vaccination. Dr. Wid earlier talks about how many tactical move and strategy that the government of Jakarta is actually working together. We are one of the partner that work closely. We were in Jakarta. We first shows that vaccination can be done through drive-through. So I still remember Dr. Wid and also the Ministry of Health together with us. We worked together in opening the first drive-through in Indonesia of COVID of vaccination that went through to 134 locations in 8 provinces in all around Indonesia. And I think, as a matter of fact, today we can proud to say that we have moved significantly well with regards to the vaccination. And the last part that we do together with the government of Jakarta was also providing extending our service on the oxygen supply. So we are working closely with the government of Jakarta as well by providing Rumah Oksigen together with Kadin and GoTo. Rumah Oksigen is oxygen house. If you remember at that time, there was a big challenges of getting oxygen. So we provide, so we try to solve it by creating access directly to the oxygen factory and providing like a shelter house with it. And we also provide multiple oxygen generator that we send directly to many of the government, government hospitals all around Jakarta, but also all around Indonesia. This is one example where private company together with government, we are actually working hand in hand. We raised over $4 million together with other startups and other key figure leader to provide this oxygen concentrator and generator donation for the country of Indonesia. So you can see this is how Indonesia is all about. We have this one big word called gotong royong. That means we help hold hands together to help the country together. So I think this is a great example of gotong royong in fighting COVID together between public and private for a better off Indonesia. And I can only speak extremely high on how the government of Jakarta, in this case, the governor, the Kadin Kes Ibu Wit, has been always be a great champion for this example of public-private partnership. Thank you very much.
Thank you very much, Mr. Jonathan, for an interesting presentation. I agree that the idea of gotong royong between the private company and the government, and it's good news that Halodoc made a huge collaboration with the government. Nowadays, we know that the telemedicine became the main alternative to access health services, especially during the pandemic, because people are still afraid, maybe reluctant to go to the hospital, including me. With the technology, Halodoc appears to simplify and to make public easier to access health services. Once again, thank you very much, Mr. Jonathan. We're going to see you on the Q&A session. Ladies and gentlemen, I also would like to inform for all participants watching, you can scan the QR code from down below to get a chance for winning free voucher from Halodoc. This is very interesting. And next, let's hear from Mrs. Francisca Mardianingsi, MPH, our third speaker, as WHO Indonesia National Professional Officer. Good afternoon. Mrs. Francisca will present urban health towards healthier, resilient, and just cities. Mr. Francisca, the floor is yours.
Thank you, Madam Moderator. Am I audible clear? Can you hear me?
Yep, we can hear you.
Hello.
All right, we will get back to you,
Yes,
Mrs. Francisca. Maybe there is a little technical problem.
Connection.
All right, we will get back to you, okay, Mrs. Francisca. And now we have Mr. Ahmed Hassan as the director of PT Roche Indonesia to give a presentation. Mr. Ahmed will talk about the value of in vitro diagnostic in urban health digitalization era. Mr. Ahmed, the floor is yours.
Thank you very much, distinguished ladies and gentlemen. Good afternoon and Assalamu alaikum wa rahmatullahi wa barakatuh. During this pandemic COVID-19, Roche as an in vitro diagnostic company faced a tremendous challenge. Since in earlier days, there was no effective treatment was identified. So COVID-19 testing was considered an effective way to identify and control the spread of the disease among various other preventive techniques. We are honored to work with Jakarta government and across Indonesia to build up capacity and infrastructure to combat the pandemic of COVID-19, and starting from a very low base of 20 labs doing 2,000 PCR tests a day across Indonesia, with a shortage of qualified health workers, We worked hand in hand with local governments to increase the national testing capacity at a level where we were able to establish a good network for effective control. So talking about urban health, all around the world, we see the more people move to bigger cities to chase their dream lives. As the fastest urbanization country in Asia, Indonesia is also urbanizing rapidly. Some estimates suggest by 2050, almost 3/4 of Indonesians are expected to live in the cities. This urbanization brings an additional challenge to national and local governments for planning a sustainable healthcare infrastructure. Today, over 85% of mature deaths from non-communicable disease, such as heart disease, cancer, diabetes, occur in lower and middle income countries. Urban health is complex because the solution to health challenges in towns and cities do not lie with the whole health sector alone, but with a decision made by others like local governments, education, urban planners, engineers, and those who determine physical infrastructure like access to social and health services. One successful example in managing this global COVID pandemic is close collaboration among relevant stakeholders while also taking rapid action with maximizing the digitalization in the healthcare system. Utilization of digital technologies in healthcare will improve the quality of care and operational efficiency by facilitating clinical and administrative tasks, so help solve the shortfall of health workers. When we think about our future healthcare system, the use of these digital technologies, previous slide please, use of these digital technologies will give us unprecedented opportunities for global public health as well as in Jakarta in next 20 years. So pandemic has opened the world's eye on how critical the role of diagnosis is. COVID-19, previous slide please. Last slide. Last one please. Yes, previous, back. Slide number 3. Yes, yes, thank you. So pandemic has opened the world's eye on how critical the role of diagnosis is. COVID-19 has pointed out the key and significant role of laboratory testing both for diagnosis, before treatment, during the treatment and medication, and even post-COVID-19 follow-up to ensure that there are no residual impacts of the disease. As also noted in the bulletin by WHO, diagnostic testing has become indispensable for diagnosing and monitoring disease, for providing prognosis, and for predicting treatment response. We at Roche believe that we have a key solution, a fundamental piece of the puzzle in tackling this ongoing healthcare crisis. We believe the starting point has to be prevention and early detection, supported by a strong research and development process. If we can keep people healthier for longer and prevent the serious disease from developing, then we can simultaneously lift a significant burden off the shoulder of the healthcare system, while more importantly saving people's lives. Whether it is cancer, heart disease, infectious disease, or other serious health threats, prevention and early direction are key, and these depend on high quality diagnostics. These tools exist to prevent or at least limit the impact of life-threatening healthcare conditions, but they are still rarely used nowadays. Now is the time to look at healthcare system alongside the innovative diagnostic solutions that exist and to radically simplify how innovation makes its way to patient care. At this point, we can save more lives at a relatively lower cost. Next slide, please. Roche Diagnostic has performed more than 23 billion tests in 2020 alone, and that generated enormous data, making us one of the largest providers of real-world data in healthcare. In 2020, we increased our investment in research and development by 10%. We single-handedly invest in R&D more than our next 3 companies combined. Next slide, please. So what was our contribution in COVID-19? Roche Diagnostic itself is taking a lead role in an exciting partnership to support cities across the globe, including Jakarta, to spearhead the design, planning, and implementation of state-of-art solution for the diagnostic of these diseases, especially during the healthcare emergency like the COVID-19 pandemic. We have to build capacity for diagnosis and detection of the COVID-19 using molecular polymerase chain reaction or PCR testing by working together with the Ministry of State-owned Enterprises, Ministry of Health, Jakarta City Government, Indonesia Doctor Association, and authorized labs and hospitals. Overall, we contributed to the national capacity for COVID-19, providing testing to the more than 20 million Indonesians. In total, we have set up more than 200 PCR labs across Indonesia. Next slide, please. We also partner with Medical Association on healthcare practitioners' knowledge on the latest information on the disease. Roche helped build the capabilities of COVID-19 testing to over 11,200 HCP by providing more than 6,000 hours of training on performing quality tests and new trends in management of COVID-19 disease. We engage clinical pathologists, the Indonesian Association of Clinical Biochemistry, documentary, pulmonologists, and anesthesiologists for education and training. Most of these were done using digital channels, except where a hands-on exercise on instrument was required. We are beyond grateful that our work has been appreciated by many, including when we were awarded as the most trusted medical care provider in Indonesia by the Healthcare Insight magazine. Next slide, please. When we collaborate with large cities, one thing that comes up to my mind is complexity of the people and their lives. One area to help simplify the complexity in big cities is digital health, which has been on the radar of many governments and policy makers in recent years. In a vast country like Indonesia, where the urban-rural divide cannot be solved easily due to geographical challenges, a tailored approach using digital technologies where necessary could be the answer. One of the interesting projects that we have been working on is connected ambulances. So the background is the research suggests that in critical emergencies, 70% of the death rate occurs before even patient reach the hospital. Jakarta, as Indonesia capital city, has one of the worst traffic congestion in the world. So connecting point of care testing with Internet of Things in the ambulance, where tests are performed and results are transmitted to the hospital instantly, surely has an important role to reduce medical errors, improve patient experience, and make pre-hospital care safe and more efficient for both medical professionals and patients. Emergency care teams in the hospital are able to get the diagnostic result faster and improve care along the patient journey pathway by helping physicians ready even before the patient arrives. Thus, it can significantly increase the patient's chance of surviving during that time. Next slide, please. So as a resident of the country myself, I believe that we all want the same thing for our people, that we all are able to live our lives to the fullest together with our loved ones. To achieve that, we need a full breadth of solutions by building and developing the most innovative diagnostic solution in health on 4 principles: a system that can reduce urban health complexity, reduce per capita cost of healthcare, and advance the clinical diagnostic decision and improve clinical and patient outcomes. With those principles being at the core of what we do every day, and knowing how much we can contribute to the country during this pandemic, we can see many more potential collaboration between us and cities like Jakarta to save more lives and increase people's quality of life, to achieve healthier Indonesia. Stay healthy, stay safe, and may we always be able to give the very best to our people. Thank you.
Ahmed Hassan for Healthier Indonesia. I totally agree for an insightful presentation and very detailed. Thank you once again, Mr. Ahmed. Mr. Ahmed talk about, in vitro provides important information for, patients. It's not only for better disease management, but also for patient care. And in modern world for healthcare, in vitro diagnostic isn't just about telling the doctors whether a patient has a disease or not, but beyond that, the future of sustainable health depends on diagnostic. Next, let's hear from Mrs. Francisca Mardianingsi, MPH. As a WHO Indonesian National Professional Officer, Mrs. Francisca will present urban health towards healthier, resilient, and just city. Mrs. Francisca, hello.
Yes, good afternoon. Can you hear me?
Yeah, I think it's better. It's better sound. The floor is yours, Mrs. Francisca.
So apologize to not turning my video on, just to save the bandwidth. Maybe later during the Q&A, I will open my video. So can I have my slides presented? Yeah, thank you very much. So again, thank you, Madam Moderator, and good afternoon, all organizer from Jakarta Investment Center, representative from Jakarta Government, Ibu Wit from Dinas Kesehatan DKI Jakarta, distinguished speakers, and all participants. I hope that you are all in good health and high spirit towards the weekend. And thanks to Jakarta Investment Center and the Government of Jakarta for the opportunity to present in this remarkable event. In the next few slides, I'd like to briefly share how WHO sees urban health and why it is an important subject for today more than ever. So as you see in the slide before you, health of individuals and also for communities is the result of interaction of many factors. It is not only, it's barely actually only involved by healthcare services. Much of our health is influenced by factors beyond health sector. In fact, to a large extent, health services have less influence to health than the other factors, such as education, employment status, income level, housing, human rights, gender and ethnicity, affordability of healthy food, the quality of the air we breathe, and so on. All these factors that I just mentioned, we call it as social and environmental determinants of health. Furthermore, there are factors that call commercial determinants. It is the approaches and strategies of private and commercial sector to promote products and choices that could be detrimental to health. For example, the promotion of unhealthy foods or infamously the tobacco products. And more recently, especially during pandemic, we learned that technology is getting bigger and bigger roles in our health. This is what we term as digital determinants of health. It refers to literacy in information and communication technologies, also access to equipment and the internet. Next slide, please. Next slide. So we are talking about urban. Urban setting is a determinant of health for the people who live in the cities. We understand that cities provide an abundance of opportunities. However, the city living also makes people more vulnerable to many health risks, such as pollution, including air, water, and noise pollution, traffic injuries, limited spaces for physical activity, limited choices for healthy and natural food, crowded settlement, poor housing, limited access to clean water, and so on. So next slide. Consequently, today's cities and those of tomorrow are facing a triple health burden. There are infectious diseases, as we already familiar with, HIV/AIDS, dengue, diarrhea, tuberculosis, etc. Also, non-communicable diseases such as heart disease, stroke, asthma, cancers, diabetes, depression, and it's very uniquely to cities are violence and injuries, like road traffic injuries, drowning, occupational health injuries, domestic gender and gender-based violence. And then there is health inequities. What do we mean by health inequities? It is the disparities of health status or the distribution of health resources between different population groups. Commonly, the lower an individual social-economic position, the higher their risk of poor health. These differences are resulted from skewed distribution of health inputs, as is presented by the pictures before you. So these differences are not natural. They are systematic. They are man-made. It is unfair and unavoidable. So actually, health inequities are not exclusive to the cities. However, it may be more evident in the cities because naturally urban communities are more heterogeneous than those in the rural. Next slide, please. So during the COVID-19 pandemic, we witnessed that many cities, including Jakarta, have become the national epicenters of the pandemic. The dense population and the transport networks of the cities have amplified the spread and the transmission of the infection. However, at the same time, public health and social measure that is put in place to prevent the virus transmission have brought wider health consequences. For example, because of the social distancing measures, there are loss of employment and income. That in turn exacerbate food insecurity for certain groups in the population. Health services, especially during the earlier stage of the pandemic, have been partially or completely disrupted during the lockdown or mobility restrictions. All these conditions have added stressors to the city residents that instigate mental health disorders and violence. I believe that you have been heard the news that there is increasing of domestic violence during pandemic. That is one of the example how the COVID-19 is affecting our lives beyond the illness itself. So all these factors is actually deepen the health inequities that I covered earlier in the slide before this. It is because the social determinants of health has been affected, so that the health inequity gaps become bigger. Next slide, please. Nowadays, we're talking about COVID so much, but I think we also know that long before COVID, climate change has been affecting individuals and public health in many ways. It increases the risk and cases of malnutrition due to soil and drinking water salinization and pollution because of reduced viability of crops and other slow consequences. Climate change also causes the more frequent and more severe breathing condition because of air pollution. We also witness increasing incidence of waterborne diseases such as cholera and typhoid because of increased flooding events as the result of extreme weather events. So because of this, health system again weaken and overstretched due to the increasing cases of illnesses. While no one is safe from the risk arising from climate change, the people from disadvantaged social economic groups often being harmed first and worse by the climate crisis because they are the least able to protect themselves and their families against it. The urban poor are disproportionately affected by climate change. For example, slum dwellers' homes tend to be poorly constructed, thus the most exposed to extreme temperature and weather. Ironically, those who are most affected are often contribute the least to the cause of climate change. Therefore, in the special report on climate change and health that released in October 11, ahead of the 26th UN Climate Change Conference, WHO highlights climate change as the single biggest health threat facing humanity. As our Director General has nicely tied all these links, that COVID-19 pandemic has shone a light on the intimate and delicate links between humans, animals, and our environment. The same unsustainable choices that are killing our planet are killing us, killing people. Next slide, please. Now, looking forward, how can cities getting out of the pandemic healthier, more resilient, and more importantly, fairer? So this vision certainly cannot be single-handedly achieved by health sector alone. It requires active collaboration and all components in the government and all components in the society. This is what we term as a whole government and a whole society approaches. So what needs to be done? We need to foster policies and systems that enable and encourage people to adopt healthy lifestyle. Some practical examples include protecting open green spaces to reduce air pollution, to invite people to get more outdoor physical activity, promote inclusive, safe, and environmentally friendly public transport, enacting smoke-free city ordinances with enforcement as part of tobacco control, promote the access to healthy and natural food while restricting the marketing and highly processed food and sugar-sweetened beverage. And then the other action is to promote health through every setting. So from the school, there is a global movement nowadays to make every school a health promoting school. This is not just putting the student as the object of health services, but it is a whole community school community movement to improve their health in a very, very conscious way. Then another way is to regulate and improve the accessibility of healthy, safe, and green housing settlements. We need also to foster healthy workplaces and strengthen mental health. This is very important. We need to strengthen mental health support in all settings, including schools, workplace, healthcare facilities, and communities. Then last but not least, we need to improve the availability and utilization of urban health data to support city planning and policy making. So we need health to be in the heart of the policy making and decision making. There is a tool that is available from WHO that we call Urban Heart, and we will be very happy to assist any government to implement this using Urban Heart. So in this point, I would like to convey WHO appreciation to Jakarta government for this initiative to develop Jakarta Urban Health White Paper. We applaud the leadership of Jakarta Office Development Planning and Jakarta Health Office that have brought all technical sectors within the government and multiple non-government partners throughout the development of the Jakarta Urban Health White Paper. So we are looking forward to witness that the document will be used to provide stronger foundation for multi-sectoral collaboration and investment that are essential for Jakarta. We hope that with this document, the Jakarta will be more healthy, more resilient, and also fairer, so that no one will leave behind during the development of Jakarta. Thank you very much. Go back to you, Madam Moderator.
Amen to that, Mrs. Francisca. Thank you very much for a great presentation. One point that's very surprising, knowing that Jakarta is at number 9, the most stressful city in the world. Besides that, also Jakarta is one of the most stressful city for driving. Of course, we want to get rid of those negative statements. And thank you very much, Mrs. Francisca. And we want to need support and help, other parties, because to make a healthy lifestyle of Indonesian, especially Jakartans, we need support from all parties, not only because the health worker and the responsibility to make a healthier Jakarta. Thank you very much. And now interesting explanations from our speakers. Now it's time for the question and answer session with the participants. I would like to remind you, if you have a question, you could write the question on the chat room box. And don't forget to redeem the voucher on the email registration. And because, Mrs. Francisca, you are the latest speaker, I would like to ask you first, how does COVID-19 change the healthcare sphere, and what would be its implication to Indonesia, especially Jakarta's healthcare industry?
This is an interesting question. How this implication of the healthcare industry? Yeah. I think we already witnessed that. Yeah, I would not call it industry. It is healthcare system. It has been stretched out especially during the first half of the pandemic. Yeah, but this is actually, Madam Moderator, is not exclusive to Jakarta or Indonesia. In any countries, healthcare system have limit capacity. It is just a matter, it is bigger than one country compared to the other, but this always has a limit. So I think we all have observed from the news and that that even in the big, like we call it like more developed countries, at some point their health system is overstretched and almost in the brink of collapse during the height of COVID-19. So then it is not the question about how it is impacted health care industry as such, but the bigger question is, if we being realistic and in the future event like this is always possible to happen, how we can prevent to go down into the same pit like we have now. Yeah, that we don't have to experience the same stress, the same disruption, and then all the consequences that come across. So at this point, then I'm going to come to the importance of putting in place the comprehensive and consistent health promotion and prevention. So it's not just because of COVID. We are looking forward that we need to help people, we need to enable people to be healthier. Yeah, it's not just individual responsibilities, in everybody's responsibility, government responsibility, private sector responsibility, and also the community responsibility. Because we already over 20 months of the COVID-19 pandemic, hardly anyone not infected by the COVID, right? So the health of everyone, health of the public is the business of everyone. So it's very important that everybody is trying to support the promotion of health of individuals and the community, so that we be like a stronger community and a stronger city. So any shock in the future, we can hope that we'll be come out better. We are not going to go down as deep as today. Yeah. So that is the message that we, WHO, would like to stress here. So let's take COVID-19 as the lessons to look forward and see the importance of protecting and promoting the health of people. And this is responsibility not only government, especially not only health sector, but all sectors, all components of the community.
Indeed, Mrs. Francisca, it's a responsibility of everybody. And another question for Halodoc and Ibu Widya Stuti from Daniel Herman. Maybe to Mr. Jonathan first. For drive-through vaccination service, as Pak Jonathan said, how do you manage the patient observation? As is it mandatory for every vaccine to check the KIPI?
Yeah, so I think it's quite a technical question, but just to give you a very high-level answer for this, basically patients who are vaccinated over drive-through, they will be asked to park their car within a designated location, and they have to wait for 30 minutes. We have ICU, mini ICU, emergency ICU on the location, just to make sure, just in case if there is anybody that has a high KIPI. Those people who are waiting in the car, they if there is any sign of symptoms of KIPI, they just need to horn the bell in the car to make sure they can call the nurse that is within the perimeter. I hope that. Sorry to answer, but that's the way the SOP.
Yeah, it's pretty clear, Mr. Jonathan. Thank you. And Mrs. Widya Stuti, maybe you have an answer for the same question. For drive-through vaccination service, how do you manage the patient observation? As is it mandatory for every vaccine to check the KIPI?
Saya menjawab dalam bahasa Indonesia. Pertama, kami memang sudah berkolaborasi dengan Halodoc dan beberapa platform lain yang sejenis untuk pelayanan drive-thru. Sebelum kita melakukan pelayanan drive-thru, tentu ada rapat koordinasi untuk memastikan membahas layout yang disediakan dan tahapan-tahapannya. Contohnya adalah bahwa peserta vaksin di dalam kendaraan setelah disuntik, mobilnya tidak boleh langsung meninggalkan lokasi dan area. tapi harus menunggu di kendaraan selama sekitar 15 menit pasca suntik untuk dilakukan observasi. Kemudian ada petugas kesehatan yang standby di area observasi, juga mengatur mekanisme jika diperlukan tindakan pertolongan lebih lanjut, seperti yang Pak Jonathan sampaikan, memberikan tanda tertentu, contoh sesuai kesepakatan, misalkan memencet bel ataupun mengangkat bendera ataupun yang lain. Jadi sudah dipastikan bahwa ada tim yang memantau, kemudian ada tim yang membantu evakuasi apabila terjadi KIPI dan bagaimana mekanisme rujukannya.
Thank you, Mrs. Vidya Stuti. And the next question for Mr. Ahmed Hassan is from a private sector perspective. We can't deny that the fact that the pandemic COVID-19 has been affecting our whole healthcare system and facility. As the first biggest diagnostic company in Indonesia, how do you see the pandemic affecting our healthcare industry?
Yeah, thanks for the question. So if I see, I see two parts of this answer to this question. So basically, when the pandemic started, we were caught on surprise. So we were not ready. And like everybody knows, like the other panelists were discussing, the first 6 months were terrible. But then we as a people of Indonesia, we were resilient. We overcome this problem. We work hard. We work whole day and night, 24 hours, and bring in the solutions. We improve our hospital, we improve our intensive care units, and above all, we improve our diagnostics capacities, PCR labs that were originally 20, it goes to more than 500. And we increase testing capacity as well. So we embrace this impact, and we get ready, and we get back on our feet, and then started fighting this pandemic. But whatever investment has been done, it's by government sector, by private sector in this segment, or even from us, I think we have to now we have to maintain this setup. We have to maintain this testing capacity. We have to maintain our hospital capacity and ICU capacity, so that in future we can focus these resources to other types of disease, not only COVID, but other. We fight with our chronic diseases. We fight with our infectious diseases. We fight with our. So we are ready. We are more ready than we used to be in the past. So let's use these resources to build up, to fight other disease once COVID-19 is over. So I think, like we are anticipating, we are still ready. We are still embracing to take the impact, but hopefully we don't, it's our fear, and then it goes down. Then we focus on other chronic illnesses that are also very big disease burden, like heart diseases, cancer, and other diseases. So I think we are ready. Healthcare system is ready, far better than the past. Let's use it after COVID-19, and let's not go back. Let's not relax. We keep our standards high. I think that's from our sector. We are ready to do that, and we accept that the city government, Jakarta, and other government as well. Let's keep our focus on healthcare as we were doing it, and combat with other diseases, other problems.
Okay, Mr. Ahmed, the tool, the health system is ready. How about the human resources? Are they ready? Are they enough number of human resources?
Human resources is never enough, I think so. And for Indonesia, more so in Indonesia. So like I discussed in my presentation, we have done a lot to develop this human resources, professional upgradation of the professional skill. But we need to do in the future as well. This is one thing that Indonesia really need to work on. So like usage of digital channels. I mean, previously, whenever we had a training, hands-on training or educational, we used to bring people from outside, fly to Indonesia, and then we use them. But during this pandemic, when the traveling was not possible, so what we did, we used digitalized channel, and when we use a trainer concept. So we bring trainers who train our people, and then we train local people, and then we, of course, translated all of the training material into Bahasa, and then we Bahasa Indonesia, we communicated to that. So human skills we can improve, continuous training, number one, and number two, use our digital channels. I think these things will help us bring that the required level if it is there. Otherwise, I think whatever we can do probably will not be fully capable to build the resource or build the gap actually.
All right, thank you, Mr. Ahmed. It's clear enough. Well, back to Mrs. Francisca. Pandemic COVID-19 has been affecting the healthcare industry all over the world. Given Indonesia's limited healthcare capacity, how important are healthcare prevention efforts, such as those to tackle the country's smoking pandemic and to promote healthy food culture? Mrs. Francisca.
Yes. Okay, so like I mentioned earlier, health capacity always has limit. Health sector, I mean, so it's not possible and it's logistically impossible to have like a bed, hospital bed is for every single individual in the population. So it's not possible. So it's always a limit. Therefore, how important is the health promotion and prevention? Very important. Now that we already learned from COVID-19, is more important now than ever. Yeah, because we already see, for example, during COVID, the severity and also the risk of deaths is higher among those that already have predisposition illnesses. Yeah, especially the non-communicable disease. And the non-communicable disease, for example, the cardiovascular disease, it is resulted from unhealthy behaviors. And unhealthy behaviors, if you looking back at the presentation I gave just now, it's not just because of the individual choices. It is because of the environment, because of the policy, because of the influence of commercial. It's also information of the digital. So these are shaping the behavior of people, yeah, the option they take. So it is very important to hopefully this word is right, to engineer, yeah, to create the environment in the bigger context that support, that allow people to opt for healthy choices, including to be more active rather than sitting around, to eat healthy food rather than the junk food or sugary beverages. Yeah. So it's not just because of the person is choice, the person's only choice, but it's actually because it's been facilitated as such. Yeah. So that's why I again want to emphasize, it is the business of everyone, not only health sector but also private sector, also all sector in the government, also the community, to make sure that our environment is very supportive for health promotion. And by saying environment here, I'm not excluding the natural environment. It is also very important. Now that's why WHO also link COVID to the climate change, yeah, the health promotion with the climate change, because we certainly need healthy nature to be able to protect and promote our health. This is a very, very simple example. Yeah, if we have been educated to have more physical activity, we have to have more outdoor activities. But outside, it is very polluted. This is a lot of traffic, and we are risk to get hit by car or something. So it's not possible to do that. Yeah, so that's why it is also very important to protect nature if we're talking about protecting health. And to protect nature is not only the government or community responsibility. I believe the private sector also have roles and have a bigger opportunities to be able to contribute to that.
All right.
I think that is the response.
So it's a process, yeah, Dr. Francisca. It's not like, snapping your fingers. Thank you very much, Dr. Francisca. We are back to Mr. Jonathan from Halodoc. Mr. Jonathan, from a private sector perspective, we can't deny that the fact that the pandemic COVID-19 has been affecting our whole healthcare system and facility. As the first biggest digital health application, how do you see this pandemic in affecting our digital market industry?
I think as I mentioned on my talk, I think COVID-19 it's really a catalyst for us to do a few things together. I think that one of the most notable one, in my opinion, is how we as Indonesia, as a country, we show what we call gotong royong, right? Holding hands together. And technology or digital healthcare, it's just an enablement of that force of gotong royong between private sector like Halodoc together with Dr. Witt, for example, from Jakarta government, and also the federal government like Ministry of Health and other parts of the service like Roche, for example. If you take a look, in a way, we are all working together. We are all gotong royong. Obviously, the digital service plays a big role here because we simplify that access. People can get doctors, people can get medicine, people can get tests, people can get vaccination and others by the use of their phone. In which, during this period of digitalization, this is the best time for people to adapt to it, but also because it is also not just because it's easier, but it's also the safest. So I think it has a big impact, not just for the digital community, but also for the community itself, because they learn a quantum leap learning on how to use digital service for a betterment of Indonesian. I think that's. Thank you,
Jonathan. And before we end this session, there is one question more for Ibu Widya Stuti. Ibu Widya Stuti, are you still there? Ibu Widya Stuti, what is the government strategic plan in developing the urban health in Jakarta?
Ya, tentu kita tahu bahwa masalah urban sangat luar biasa. Jakarta sebagai ibu kota dengan mobilitas penduduk yang sangat tinggi, urban health menjadi suatu prioritas yang harus kita kedepankan. Tadi seperti yang disampaikan oleh Ibu Francisca dari WHO, bahwa bagaimana Jakarta harus mampu mengeluarkan dokumen terkait dengan urban health tadi. Pertama tadi disampaikan bahwa terkait dengan ancaman terhadap penyakit akibat iklim, kemudian ancaman terhadap penyakit tidak menular seperti jantung, gangguan pembuluh darah lain maupun endokrin menjadi sangat penting, dan itu menjadi sesuatu yang kita kedepankan. Kami tidak hanya berbasis kepada rumah sakit atau hospital, tapi kami juga melakukan peningkatan kapasitas melalui kesehatan komunitas, penguatan melalui puskesmas yang ada di puskesmas kecamatan maupun di kelurahan. Bersama dengan warga masyarakat, kita melakukan yang namanya deteksi dini penyakit-penyakit yang bisa dilakukan screening, yaitu melalui kegiatan yang kita namakan upaya kesehatan berbasis masyarakat. Jadi dalam rangka menangani urban health ini, sekali lagi, Dinkes tidak sendirian, kami bersama-sama dengan berbagai stakeholder, termasuk menguatkan dari sisi kesehatan komunitas maupun kesehatan individu yang ada di rumah sakit.
Alright, last question, Ibu Widya Stuti. What is the continuous effort made by the government to grow the investment in Jakarta, especially for health sectors?
Saat ini DKI Jakarta sedang berproses untuk melakukan transformasi digital. Hal ini tentunya berbarengan dengan adanya transformasi dalam bidang kesehatan. Jadi kami berkolaborasi dengan Dinas Kominfo dan tentunya di bawah koordinasi Pemprov DKI Jakarta memadukan bagaimana bisa menjawab kebutuhan masyarakat dan kebutuhan akan tantangan global tentang kemudahan akses. Tentu dengan platform bagaimana kita bisa mengundang investor, kami yakinkan bahwa DKI insya Allah bisa mengendalikan masalah kesehatan. Apakah itu terkait dengan masalah kesehatan yang berbasis penyakit menular, penyakit tidak menular, maupun ancaman terhadap iklim, termasuk tadi konsep tentang urban health yang kita padukan secara komprehensif melalui berbagai SKPD yang ada di Pemprov, dan tentunya kolaborasi secara pentahalik melalui berbagai institusi. Kami membuka peluang, DKI Jakarta tentu siap berkolaborasi dan mengundang para investor untuk yakin untuk hadir di DKI Jakarta.
Absolutely. Thank you very much, Mrs. Widya Stuti. And what an incredible panel discussion. Thank you very much. Much appreciate to all speakers. Thank you for allocating your time and sharing your informative presentations. Thank you, Mr. Ahmed Hassan. Thank you, Mr. Jonathan, and also Dr. Francisca. I hope you have a great week. Thank you very much. And ladies and gentlemen, next for the second session, we're going to talk about urban mobility with Rory Asari, reimaging Jakarta as an eco-friendly mobility city. We will be back after the break.
Pantai kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat. Terutama pada akhir pekan. Seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 3+1 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Rasio obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat. Terutama pada akhir pekan. Seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 3+1 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Rasio obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat, terutama pada akhir pekan, seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 3+1 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Good afternoon. My name is Rory Ashari, the moderator for the second session. Thank you so much for staying with us on Jakarta Investment Forum 2021, strengthening the post-pandemic economy through collaboration. And after we discussed about the future of urban health development in Jakarta, now it's time to talk about urban mobility, reimagining Jakarta as an eco-friendly and mobility city. Urban mobility will focus on discussing the ongoing efforts of the DKI Jakarta provincial government in providing more adequate public transportation and connecting all public facilities in the development of rail-based transportation and its impact on economic productivity. And now in this good opportunity, we will get explanations from some great speakers. Let me introduce them one by one. First of all, Mr. Syafrin Liputo, as Head of Department for Transportation of DKI Jakarta. Pak Syafrin, hello, how are you doing, Pak? And then we also have Mr. William Sabandar as President Director of PT MRT Jakarta. Pak William Sabandar, hope you're doing well. And last but not least, Mr. Julian Smith as Director of PT PricewaterhouseCoopers Advisory Indonesia. Pak Will, how are you doing, Pak? I hope you are doing as well, doing fine as well. And now, for the first speaker, I would like to invite Mr. Syafrin Liputo to present his presentation. The time is yours, Pak.
Good afternoon, honorary guests, moderator, all speakers, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to thank God for His blessing so we can meet today in this event. Jakarta Investment Forum talks with the topic about urban mobility, reimaging Jakarta as an eco-friendly city. It is a great pleasure to be here and to be able to share our experience in dealing with transportation problem, and I hope I could provide accurate information and the possibility and opportunities of investment in the transportation sector. Slide. Ladies and gentlemen, like many other cities which underwent rapid growth, Jakarta also faced the problem due to increasing people's mobility, which caused high traffic congestion, inequalities, and environment degradation. Despite of public transport betterment, Mode share of public transport user was still low. This problem occurred because of low coverage of reliable public transport. Unintegrated public transport, which leads to high fare, car-oriented development in the past, and priority for cars. These challenges lead to us realize that change from fundamental policies we needed. Slide. To overcome this problem, the government of Jakarta has transformed the handling of transportation in Jakarta from car-oriented development to transit-oriented development. We try to shift from corridor-based development to area-based development. So we could avoid long-distance and non-essential travel. We also try to shift from low density and horizontal settlement to become of compact city. Therefore, we must integrate all modes of public transportation services. And the most important things is we have to prioritize pedestrian and non-motorized transportation. Slide. In order to achieve those goals, we have carried out several progress which we can be described below. The first step was reformation of road user priority by prioritizing the movement of pedestrian, encourage the use on non-motorized vehicles and environmentally friendly vehicles, optimizing the use of public transportation as the backbone of the transportation system, and implementing transport demand management policy. The second step was develop transportation integration scheme, which we call Jaklingko. Jaklingko is an integrated system that supports policies to increase the use of mass public transportation and restrict private vehicles. The third step is to encourage multi-stakeholders cooperation and collaboration, because we believe the collaboration make Jakarta a place to pursue dreams and visions. Slide. Here is some progress for our reformation, such as the development of seamless connectivity in station area. Slide. Also, the provision of environment-friendly vehicles, where we are leaping forward in facilitating cyclists. Slide. And the implementation of e-bus provision. Slide. For improving the performance of public transport to be seamless public transit connection, Jakarta takes a bold initiative that is called Jaklingko, where the pull and push strategy is implemented, namely improving integrated public transport services with ease for the use of public transportation and applying this incentive for private vehicles. Jaklingko integrated all types of public transportation, road roads-based, rail-based, and water transportation. The integration program includes the integration of routes, payment system, data, and information, and infrastructure. Slide. Ladies and gentlemen, as we all know, COVID-19 has hit all aspects of the economy, including transportation, with the restriction on people movement and restriction of the number of passengers on public transport. The transportation business has been hit hard, with regional financial condition also declining. The transportation industry requires ease of operation, including subsidized and PSO patterns. Currently, with the improvement of the pandemic condition, a new policy has been made that allow public transportation to operate at 100% capacity. Of course, by maintaining health protocols and re-implementing vehicles restriction through the odd even scheme. Therefore, it can be expected that the demand for public transport user will return to what it was before the pandemic. Slide. Now I will tell you about our plan. As I mentioned earlier, Jakarta has changed its development policy from car-oriented development to transit-oriented development. This strategy will form an intermodal transport hub which needs support from rail-based mass transportation as its backbone. Slide. To make it happen, we have planned for the mass transit network as outlined in the Jakarta Transportation Master Plan 2039. As shown in this map, RITE is in the process of drafting a regional regulation. We call it a PERDA. Slide. This map shows the railway network master plan in more details, which consists of the MRT, LRT, and PPG that have been, are being, and will be built by the DKI Jakarta provincial government, as well as the railway network under the management of the central government. Slide. This map shows the MRT network and its progress. MRT Phase 1 Lebak Bulus Bundaran HI has been full operated and continue to Phase 2A Bundaran HI Kota that is being constructed and tendering process. We also preparing for Phase 2B, 3 and 4. Passenger demand per day in 2030 is shown in the slide. This map shows the development of LRT line and its progress. LRT Phase 1 Velodrome Kelapa Gading has been fully operated. Phase 2A Kelapa Gading is in the process of preparation of LARAP and financial study, where Phase 2B, 3A, 3B, and 4 is being prepared. Passenger demand per day in 2030 is also shown in this slide. Transit point is more important type of development because it will change people travel patterns behavior and become a generation center for mass transportation. Therefore, a number of potential transit points are planned to be developed as TOD and non-TOD areas. Slide. Ladies and gentlemen, with the change in the development paradigm and with the recovery of the Indonesian economy in line with the decreasing prevalence of COVID-19, there are more opportunities for cooperation in the transportation sector, including for the construction of MRT and LRT as already included in the Jakarta Transportation Master Plan, as well as the supporting facilities such as TOD, transit point and station, park and ride, bike lane and bike share, e-bus, and so on. Right? We offer you opportunities for cooperation and collaboration, and I will fully assist in the implementation of this target and be able to work together to get the expected results from this webinar. Thank you and keep safe. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Pak Syafrin Liputo, thank you very much for your presentation. As a Jakarta citizen, I'm very optimistic about the future of our transportation system. And there is a fundamental policy changes which is so needed and which is so looking forward by Jakarta people, where car-oriented development will be shifted into transit-oriented development. And moreover, priority is given to pedestrians, environmentally friendly vehicles, and also public transportation. And the government, the local government of Jakarta, will be giving this incentive for private vehicles. This is something that we've been waiting for because we don't want to see our streets full of cars, but we want to see more people use public transport. And there is a collaboration and also integration of infrastructure and then transportation modes, which is called Jaklingko. So if you're not aware, and not familiar with Jaklingko, Jaklingko is actually a scheme, a method that creates an integration of infrastructure and facilities, as well as operational system of public transportation. And we do really appreciate Pak Liputo about the paradigm shift that we see from your presentation, in which car-oriented development will be shifted into transit-oriented development, and it will transform our cities through people-friendly planning policies. And last but not least, health issues is also being taken into consideration, as well as accessibility, in which increasing the rates of walking, cycling, and the use of public and shared transport that is accessible to all citizens. So thank you very much, and it is a very good news for Jakarta people when it comes to our future transportation shift. Thank you very much. And ladies and gentlemen, also don't forget to book your one-on-one session with Jakarta policymakers in Meet the Leaders session, November 15th at 9 to 11 a.m. WIB or Indonesian Western Time. And next, let's listen to Mr. William Sabandar as the President Director of PT MRT Jakarta. Pak Will, the time is yours.
Thank you very much, Rory. Good afternoon, everybody. Let me first take my presentations from what Pak Safrin has presented here, because this is very much related to Pak Safrin presentations. The future of Jakarta mobility, and I would like to focus on the development of MRT Jakarta and how MRT Jakarta has supported the development of public transport systems, moving from car-oriented development to transit-oriented development. So the first one is the link or the network of MRT Jakarta, which Pak Safrin also has presented. We have the red line, which is now in operations, 16 kilometers from the south to the center of Jakarta. And we continue to develop the line to the north of Jakarta. At the same time, we are preparing the east-west lines, and also in the south, there is a new line, the phase 4. And we are hoping that with the ambitious plan, we would be able to create a network of MRT integrated with other transport systems in 2030, reaching all the populations of Jakarta, even greater Jakarta. And the MRT Jakarta network, as you see, is the one that is operating right now. You can see from Lebak Bulus to Bundaran HI. And it was operating every day right now. So it was actually bring the new environment of Jakarta. This is the phase 1 MRT Jakarta, which was launched by the president on March 2019. The new cultures of MRT Jakarta, you can see that the rise of MRT, the emerge of MRT Jakarta bring a new culture. With, for example, you can see how people with disabilities can now really enjoy the public transport systems, convenience, the 100 on-time performance. The travel with using MRT Jakarta, you will be never late. You have to stay on time. And the station itself is very clean. You can see people queuing. With a friendly security officer, friendly services. What is more is actually it creates a more friendly city. Some of the area, for example, along the line of MRT Jakarta, you can see more interactions of people, stations or area which used to be a place with full of cars, traffic jam. It was now turned into the place for people to interact. You can see in one of the spots we are promoting a place for a library, for example, a place for art, and there is a room for people using bicycles and people also using pedestrian, and this is something that create a more friendly city of Jakarta. The good news that might be you have heard that now Jakarta has moved from used to be the city with number 4 or number 3 in terms of the most congested city in the world to number something like number 30, 31 in the world. So it is good news, which is moving really Jakarta to a more friendly city, a more environmentally friendly city. Now, this is something that cannot be done only by MRT Jakarta. The governor has introduced the concept of integrating the whole public transport system of Jakarta, which is called Jaklingko. Jaklingko is the process or is a system that integrates all public transport system in Jakarta. The MRT, the LRT, the bus, and even the train systems comes together and form a network of integrations. And when we say integration is not just happening at the physical level. Yeah, you can integrate the network, for example, as you see in the graph here. Yeah, you can see some networks, but integration also happen at the surface level. Yeah, how the time performance, the schedules was integrated. And furthermore, now we are in the process of integrating the ticketing systems. Yeah, so by next year, Jakarta will have ticketing integrations, which is every person can have their own account. And this is what we are promoting together with all public transport systems, development of mobile application systems and ticketing integration, which is basically using a single card or a single mobile applications to be used and to make use that the importance of people convenience, people satisfaction on the public transport is put at the first priority. So this is how we see the public transport, and in this case MRT, as transport network system developing. The transport system is not just transport, it's a lifestyle business, and more importantly, it's a city regenerator. It's how it changed Jakarta from a city heavily dependent on private cars, now to move into a city that is dependent on public transport. And when you say public transport, then you move the movement, you move the activity of the people along the corridor of public transport. We develop what we call it transit-oriented development. So rebuilding the city, for example, along the MRT network. So now you can see some of the area, for example, along the line of MRT Jakarta. From south to north. We can see some characteristics of transit-oriented development. And we can see from, for example, its mixed use, social equity. We promote connectivity improvement, quality of life, environmental sustainability, and also economic regenerations. And these are the 5 transit-oriented development is being promoted by MRT Jakarta right now. Starting from transit-oriented development of Lebak Bulus as Gerbang Selatan of Jakarta, Fatmawati, and move to the Blok M Sisingamangaraja, and then kawasan Istora Senayan to kawasan berorientasi transit Duku Atas. You can see some progress happening now at Duku Atas, and also last week we start to develop urban system at Blok M, and this is all to create a city which is very much friendly to public transport and moving the activities along the line, along the MRT line. Now you can see MRT as city regenerator. We are promoting transit-oriented development. This is one of the activities happening at transit-oriented development in Duku Atas. With the buses coming, the Transjakarta integrating. Whereas Ruang Baca, we are building a transport hub. Which is all the public transport will integrate and building an area, an ecosystem, which the third space where people can interact. Yeah, all activities can happen here, and people have more rooms to interact and reducing the social disparities among people because all people can interact in the same places. City regenerator, you can see some of the aspects. We are developing Lebak Bulus, yeah. We are developing point squares. We are developing some of the transport systems. Now we are working together, for example, with University of Indonesia to assess the benefits of the interventions like MRT Jakarta to the city, and it is sure that there is a functions of the benefit of the transport systems, for example, to reduction of traffic jams, yeah, for environmental equality, yeah, especially for the satisfaction of the people, and also in terms of reducing the times used by people in traveling, and also the time spent by people and the rupiah spent by people in traveling. It's much more efficient right now. You can see also the economic impact, for example, which is very clearly the phase 1, phase 2, and phase 2B brings benefits very much to the development of the city, to the economy of the city. Now, this is a new things that we are, in addition to city regenerator, we are now trying also to bring a new programs. Yeah, we call it Birukan Atap, Birukan Langit. This is the program of the government of Jakarta and how transport, public transport is promoting, yeah, the use of clean and renewable energy. Yeah, we are using this. Yeah, and MRT Jakarta, for example, promoting the use of some of their facilities, yeah, like stations, yeah, to replace to put the solar rooftop schemes, for example, yeah, we are putting some renewable energy certificate and renewable energy power wheeling. But the Birukan Atap, Birukan Langit programs is actually aims to revolutionize the MRT Jakarta energy systems through the integrations of renewable energy infrastructures. And the plan of the programs was actually quite ambitious. Yeah, we are aiming for achieving 25% of our facilities using renewable energy by 2025, and by 2040, what we are planning is to use 100% using the clean electricity. Last but not least, this is some of the illustrations. We are using the rooftop PV installations from MRT Jakarta Lebak Bulus Depot by trying to offer some opportunities for investors. Yeah, so investors, friends, partners, please come. So we are inviting for cooperation, for partnerships. There is an investment. There is a potential investment, for example, in building transport networks. Yesterday we signed MOU with some operators. With Crossrail, for example, we learned from London experience how to build a good transport systems. We want to learn from, or we want to work together with all partners all over the world. We want to spend some also partnership in transit-oriented development, but last but not least, we want to spend also promoting partnerships in our initiative on clean energy. Let me stop here. Thank you. Back to you, Rory. Thank you.
Pak Will, you know what? When I first tried MRT a couple of years ago, I thought I was in Singapore, but and I was so proud to be in MRT. And I studied in the UK, and I tried their MRT system in London, and I thought, wow, Jakarta is much, much ahead when it comes to the quality of the cart, the quality of the train. But when it comes to network and coverage, okay, we'll get there. We'll get there sooner or later, right? And in 2030, as you said, MRT will be integrated with all transportation modes in 2030. And it, of course, brings pride to Jakartans and also foster discipline among our people, which is, this is a big, this is something that we predicted to be really hard to be implemented, but you did it. MRT did it to discipline our citizens when using public transport. And, this is still in line with what Pak Kadishub said earlier, that Jakarta is moving to be a more friendly city. And Jaklingko, this is the integration of transportation, not only the transportation in physical manner, but also system and also service level. But my question would be, would that integration be challenging because there's still, like sectoral ego, Indonesian classical problem? We're going to talk about that later on, Pak Will. But before that, I'd like to welcome Mr. Julian Smith, Director of PT PricewaterhouseCoopers Advisory Indonesia. And I would like to invite Mr. Julian Smith to present his presentation. Time is yours, Pak Jul.
Selamat siang, Pak Rory, Pak Syafrin, Pak William. If I may see the slides. So, echoing what you said, Pat Rory, I would like to congratulate Pat Syafrin and Pat William. I've lived in Jakarta for 6 years, and really what we see today is a total transformation. And I think if you look at some of Pat William's photos, if you showed them to the citizens of Jakarta 6 years ago when I moved here, they would think, no, that cannot be my city, that's London or Paris or something. But yes, it's really happened here. And I remember going on one of the test runs of the MRT, and somebody came from Sumatra just to have their photograph taken on the MRT because they couldn't believe it was happening in their country. But yes, it's real. Now, I don't have so many pictures. I'm more talking about the technical details in terms of how we make this happen commercially when we talk about transport-oriented development. Next slide, please. So, if we talk about the need for it, I think we have to remember that until recently, the average Jakartan was wasting 22 days per year waiting in traffic jams. During the pandemic, obviously, that has not been happening, but I think we're soon going to be back to something near that, except that, as Pat Williams says, there already has been a positive impact. So hopefully we will never go back to that situation. Next slide, please. Because we've already seen 3 railway lines built in Jakarta, which is after many years since independence when nothing was built. So massive progress in 4 or 5 years. The most important point I want to explain is what is transport-oriented development. And it's sometimes confused with the other concept of land value capture. So transit-oriented development is all about planning the development of the urban space around transport so that people do not want to use their cars, so that people are directed towards public transport and even walking. I think we still have a way to go in Jakarta to really encourage people to walk. But by having nice, convenient public transport, that encourages people to get used to walking on the first mile and the last mile because they don't have to worry about car parking. Then in parallel, we have the commercial concept of land value capture. And what that means is if you build good public transport, it actually increases the value of the land near to the railway stations. But that's not enough in itself, because who benefits from that? It's the owners of the land. So the key to successful TOD and land value capture is to measure the potential land value increase and then to design a commercial scheme that recycles that the land value uplift into paying for some of the infrastructure. Because why should the taxpayer pay for the infrastructure and then the landowner benefits? And it's actually quite challenging to do that, but there have been successful schemes, and Jakarta is already starting to implement some of those, copying best practice around the world. Next. I think we can go next one because Pak Kadisub already covered this. In Jakarta, I think the best TOD opportunities, in fact, LRT Jabodebek was built with TOD in mind. And you see there are quite a lot of places where the Adhikaria is already promoting urban development, residential development around the stations. And likewise in MRT, not only is there a regulation which enables MRT to do deals with the private sector to recycle value to pay back some of the infrastructure costs that's already been spent, but of course it helps to fund the further development of the network. So even though, for example, Hotel Indonesia Bundaran HI station is already built, there'll be further value added to the land around that when the northern extension happens and there are more passengers going through that station. So the key is to capture that value for the benefit of the public expenditure. Next. my slide, I don't know if my slide is clear enough, but what we show on this slide is that the biggest potential for TOD is some of the areas not in the very center where the land is already very valuable and is already well developed. But you can see if you look at some of the outlying stations, not just on MRT and LRT, but also on Kereta Api Indonesia's commuter network, there's still land for development. But what needs to happen is an improvement in public transport services. So unfortunately, the MRT is so good that whilst I think actually the Kereta Api commuter service is good, it's not new and shiny like the MRT. So the potential is for TOD development on the commuter network to help to pay for an upgrade in services, new rolling stock, for example, on the KE commuter network. And the biggest potential is perhaps on some of the stations that are not in the very center. Next slide. And this is a slide that just explains that there are some regulations already in place, which provides a mechanism. I think they still need to be optimized so that the maximum value is captured for to fund the development. Next, please. So I just want to talk a bit. I'm from London, as you may have guessed, and I think Crossrail, Pat William referred to the MOU that's been signed. Crossrail provides a very good example of where now most of the infrastructure has been paid for by the government, but you can see it provides an example of TOD because if you look at the pictures along the bottom, it started with the government investing in a light railway network to the east of London around Canary Wharf, and that encouraged basically a new financial center to be built. I think we haven't even started to think about the potential of, say, building a new financial center at Lebak Bulus or further south to ease the pressure on the center of Jakarta. But this is what happened in London, and then the Crossrail was the next stage. What originally happened with the Crossrail station to the east is that the property developer paid for the station at Canary Wharf. Next slide, please. And this slide shows that to have a successful transport operator, this is something we still don't have in Jakarta. What we really need is one transport authority for the whole of Greater Jakarta, because it would make Pat Williams' life so much easier if he only had one boss. Because what we have is still different authorities, the ministry, the satellite cities like Bogor, Depok, etc. There's not one unified authority to make decisions. And what happened in London when Transport for London was created is you can see on the left, there are many different possible sources of funds ranging from road pricing, tickets, land value capture revenues, as well as the tariffs that have enabled that significant investment in transport in London. Actually, when I first started working in London, people used to complain just as much as they complain now about Jakarta, and we have actually seen a transformation partly driven by having a unified transport authority for the whole Greater London. Next slide. And just a word about the funding of Crossrail. There are something like 30 different sources of funding. One of the major ones was a dedicated transport tax paid by businesses across the whole of London that was specifically allocated. And against that transport tax revenue, the Transport Authority was able to borrow money to pay back over 20 or 30 years. At the moment, we do not yet have a viable framework for municipal bond issuance in Indonesia. It exists, but it's too restrictive. That's something, if it was modified, would make a big difference and help to fund the investment that's needed. But alongside that, on the left of this diagram, I mentioned Canary Wharf. There's another developer, Barclay Homes. If we go to the next slide. This is my favorite example of a successful TOD scheme. The Crossrail line was originally planned to go straight through a very deprived, rundown area of London called Woolwich. And my client was a property developer. We went to the government and we said, look, instead of just running a tunnel under this area of a lot of social housing, let us build you a station. We will pay for the station. All you have to do is make sure the trains stop in that station. And this, in the end, we persuaded the government. The developer built the station, and on top of it, they were able to build 1,000 apartments. So not only did they make a profit out of the development, they provided a massive improvement in public transport, connecting the people from this quite poor area of London to high-paid jobs in the City of London. And so that was transformational for the people around the TOD development, and also beneficial for the economy and beneficial for the private investor. Now that is a model that really could happen here in Jakarta also. Next slide, please. And finally, I'll just give you a picture of Hong Kong, because everyone talks about Hong Kong as the best example of TOD. But I think if Pat William had all the luxuries of Hong Kong, which is the Hong Kong MTR owns a lot of property. Unfortunately, MRT Jakarta does not own a lot of property, so it doesn't have the same advantages of being able to just rake in the property profits to pay for the transport development. It's more complicated here. And that's why I think London is a better, easier case study to follow. But just to show you the example of TOD, if you look at the middle on the bottom, in the middle on the bottom, the bullet points are all the things you have to think about to have a successful TOD scheme: connectivity, environmental sustainability, and making sure that the transport is really integrated in all aspects of urban planning. And essentially, that's what TOD is all about. I think that's all I have to say for now, Pat Roy. It's a pleasure to be here.
Thank you so much, Pak Julian, for the very clear explanation about TOD. So the potential of TOD in Jabodetabek is really huge, but as Pak Julian earlier explained very clearly, that transit-oriented development, or TOD, is a spatial development concept that focuses on the integration of intermodal facilities and also intermodal areas within a 400 to 800 radius from the transit mode of mass transportation. So this is really clear. And the TOD development opportunities lies on LRT Jabodetabek, in which developers can build LRT city, and it will bring also economic benefits not only for the people but also the transportation world at large. And also MRT Jakarta development has also a huge potential of developing TOD on its own term. And you've also pointed out about the case study 1, Transportation for London, or TfL, in which TfL with Crossrail becomes a TOD master planner by developing a new economic corridor along the Elizabeth line. But I'd like to ask you a question before we start our discussion, Pak Julian. So you mentioned about the importance of having one head, having one boss. Would that be applicable in Jabodetabek context when it comes to transportation in this what do you call it, agglomerasi area?
Very much so, Pat. I mean, unfortunately, the Indonesian constitution was designed in very different circumstances from what we see today. And just to give you one example, if you ask who is responsible for a bus service in Bogor, for example, then it's the municipality of Bogor.
Yeah.
If you ask who is responsible for a bus service from Bogor to Jakarta, then it's the Ministry of Transport. Sorry, it's the Ministry of Transport. It goes even one level above the province. So it is impossible to coordinate all of this efficiently. And that was actually the situation we had in London. A long time ago, Margaret Thatcher actually abolished the Greater London Council. And finally, everybody realized you can't run transport in a major city without an integrated transport authority. And that's why Transport for London was created.
And one of the best in the world nowadays. So I think it's a very good input for the Indonesian government to maybe learn something about the policy of Margaret Thatcher back then. Thank you, Bajul. Now let's start our discussions, gentlemen, and also to our viewers. I'd like to start off with Pak Kadisub, Mr. Syafrin Liputo. Pak Syafrin, I'd like to ask you about the pandemic has changed the way the public perceive mobility, Pak. They prefer vehicles like cars and also motorcycles over public transportation, which they perceive much safer and at the time being maybe much more efficient. How is the government strategy to persuade and to lure back the public to use mass transportation, Pak Syafrin?
Thank you, Mas Peruri. Currently, with the improvement of the pandemic condition, a new policy has been made on PPKM level 1 that allows our public transportation to operate at 100% capacity. Of course, by maintaining health protocols both in infrastructure facilities and in public transportation organizer, which is supported by regulation. Implementing vehicle restriction through the odd-even scheme in major roads accelerates the implementation of integration both physical, speed, convenience, payment system, as well as data and information, so that people can feel the comfort, timelines, and costs that are most appropriate. Therefore, it can be expected the demand for public transport user will return to what it was before the pandemic, even increase in accordance with the increase in mobility of the community. Thank you.
Right, Pak Syafrin, before I move to the next speaker, I'd like to know, so we have seen Jakarta's transportation is developing into a greater facility to facilitate many people, but especially commuters. What I'd like to know is the opportunities for the private sector and also investors to participate in the transportation revolution of Jakarta. What can they eye and what can they maybe jump into?
With the change of the development paradigm in Jakarta from car-oriented development to transit-oriented development will turn off many infrastructure and facilities that need to be built and developed, such as the construction of transit lines, integration points, and TOD areas, as well as the development of first and last mile facilities, such as pedestrian lanes, bike lanes and bike share, park and ride, and the development of electric vehicle programs. This development requires considerable financing in the midst of limited government financing, both central and regional, in the development of transportation infrastructure in particular. Private sector or investor are given space, even facilitated by regulation ranging from Perpres 38/2015 to the implementation of the Permen PPA that regulates the participation of business business entities with the government. Moreover, with the potential fiscal impact of the next 2 until 3 years, private sector are privileged to play a role. For example, the development LRT Jakpro Phase 2A, 2A, 2B, or 3B are in the process of finding a strategic partner for PPP, public-private partnership. Likewise, MRT is also looking for a strategic partner, PPP. Construction of bike lane with, we call it SP3L, and the development of TEDU MRT Jakarta is also being pursued in PPP.
Right.
Thank you.
Thank you, Pak Syafrin. I'd like to move to Pak William now. So, Pak Will, you've mentioned and you've explained about the first corridor of MRT, which Jakartans have been enjoying. And, you know, it's been so precious and so smooth for us to try. And we're still looking forward to the completion of the second corridor. But what I'd like to ask is, how far is actually the current development of creating TOD and the integration of all transportation modes?
Let me continue from explanations of Pak Julian. Yeah, that's your question actually, Rory, before. In fact, there has been instructions from the presidents to integrate the transport systems in Jabodetabek, in Greater Jakarta in 2019, because of his experience as the governor. And it's been followed up by Pak Anies Baswedan, the governors, and the ministers of state-owned enterprise, Pak Erick Thohir, and also the Minister of Transport, on trying to design an institutions like Transport for London which will be an umbrella of bringing together all the systems, whether it is municipal systems, city systems, or the provincial systems into one institution. And under this umbrella, we are actually working together. For example, MRT Jakarta is working together with PT Kereta Api Indonesia, with Transjakarta, with LRT on designing systems that integrate our service and integrate our ticketing systems. It's work on progress, and this is something that we are hoping with more government coordination, especially between central government and provincial and municipal government. We really can see an effective and concrete umbrella institutions that not just organize this coordination at the policy level, but also at the action level.
Pak Will,
now,
sorry, before you continue, the question is then, how powerful will this umbrella institution, when we're dealing with ministries, we're dealing with government bodies, how powerful this will be?
Yeah, it's going to be very powerful because it's managed not just the policy synchronizations, but also, for example, in integrations of service, the roads, for example, integrations of ticketing systems, for example, because this is something you see now. Every operator have their own ticketing systems. What Pak Safrin has been struggling doing it right now is how we can actually one ticketing systems, and this will make policies and even subsidy systems become more efficient. Because at the moment you have a subsidy, for example, traveling from central government, you have subsidy from every provincial and district government, for example, which if you can develop one policy systems in terms of subsidy, we can even bring more efficient subsidy allocations to the people, and this will increase the satisfactions and the convenience of the public transport system. So this is in the pipeline. This is in the working, and at the corporate level, we are actually working with all the operator. Now, addressing your questions, I think Rory, it's we have to think now the development of the transport systems or the network, not just as the network, like what Julian explained, is actually on the concept of the transit-oriented development. Because this is not just building a transport systems. This is actually revolutionize the city. The name that we are using, urban regeneration. This is very much used by the government. How when you have a transport system, a mass transport system, you can actually regenerate the city. And this is we learn from phase one. For example, when we build the networks, but we haven't started to change the city. Now, what we are doing to phase two, as we did phase one, we are also building the city, the new city. And this is, I think, the importance of when you start the development, when you're building, start to plan the operations and also start to plan the transit-oriented development. And this is the concept that we are currently doing.
Pak Will, thank you very much. I'd like to move to Pak Julian. Pak Julian, according to what Pak William said, that there will be an umbrella organization that is so powerful. Do you see this as a light at the end of the tunnel?
Definitely, Pat. I think and one of the things to understand about Transport for London is it didn't happen overnight. And I'm aware of the plans that are in progress, and I think it's all going in the right direction, but it can't happen too fast. And there's a lot of detail that needs to be got right in terms of regulations, institutional structures, at every level, from strategy, integrating the transport strategy with other strategies like healthcare, education, right down to the operational planning and the ticketing. So step by step, but as fast as possible. But yes, there is light, and it's going in the right direction.
All right, so Pak Jo, I'd like to ask you this. The number of Jakarta's population is currently growing rapidly, and we have witnessed the significant growth in major infrastructure projects. Can you please share your insights regarding how is it so important for a big city like Jakarta in accelerating the development of railway concept and other facilities that will accommodate public needs? Pak Jo, are you still with me?
So I apologize. I I didn't realize you were speaking to me.
Yes.
So could you repeat the question?
So how is the train-based transportation so important, so integral for Jakarta to increase the quality of their life and the efficiency of transportation moving around?
Well, I think, yeah. As I mentioned earlier, I mean, we've only had 3 railway lines built in Jakarta since independence, whereas in other cities, it's a continuous process. So you don't wait to finish building one before you're planning the next one. And I see Pat William you saw from his map that he's looking ahead. But the biggest challenge, I think, is where does the money come from? And I think that's where the question you asked earlier about the private sector comes in, because we have to. The framework is already there in Indonesia, as Pak Syafrin said, to bring in private sector. It's very important that people don't just think, okay, here's a space, here's a line on the map, the private sector can build it. We've got to get the project preparation done right in order to attract investors, so that they can see that they can make a reasonable return and work alongside the public sector, and then you can have continuous development of a sort of virtuous circle of development of public transport happening.
Okay, before moving to Pak Syafrin, I'd like to ask Pak William again. So Pak William, the government is currently opening for public-private partnership, but in some way we are quite concerned about the possibility of the ticket price would go high, would soar. How actually MRT will balance between public partnership or private investment versus the ticket price being kept at a moderation level?
Yeah, there are 2 things here, Rory. Number one is in terms of efficiency and effectiveness in funding, we have to move from only government investing in the infrastructure development into the public-private partnerships. So like at MRT now, phase 3, we are looking for more investment in private sectors get into this into the project by integrating the transit-oriented development. In number 2, in terms of the increase in ticket pricings, this is how you really need to manage effective and efficient service. As there will be a more line developed, if we cannot manage the subsidy systems, then there will be a more burden on the government to put more on subsidy. That's why what we are learning from managing the systems, on ticketing systems, there should be a way to manage an integrations in ticketing process, the account-based ticketing systems that now in the planning process that we are preparing is one of the way under the umbrella of one institutions is to actually put an efficient way of designing the subsidy. When you can bring down the subsidies and you can control the cost, then there is an incentive of private investment, for sure, to develop the line further. So that will be my suggestions on how to bring balance on investing by involving the private sectors, also putting a more efficiency on subsidy, so we can actually maintain sustainability in terms of infrastructures, constructions, and transport operation.
Pak Will, we don't want to see any dichotomy between the central government and regional government when it comes to subsidy, but the public needs to be given light about who will pay the subsidy, Pak.
Well, it's a subsidy basically coming from the government revenue, right? And this is the way how it transfers into the service.
Okay.
System like that, yeah. And I think this is something that we really need to work out by benchmarking into many systems, yeah. The subsidy needs to be given to the right persons, yeah. At the moment, our standard of subsidy is given the same to all level of people with different economic background. We don't have the systems, for example, you can give more subsidies to pensions, to people with, to students, something like that, yeah. But this is something that we have to work out on giving the right subsidy to the right people group.
Giving the right subsidy to the right people group, and working out on who will pay the subsidy eventually. Okay, thank you, Pak Will. I'd like to move on to Pak Syafrin. Pak Syafrin, what is your continuous effort in bringing more investments into Jakarta when it comes to transportation development?
I think inviting stakeholders in the planning process, including LRT Jakarta and other transit line, considering that the construction requires many parties. And then encourage public-private partnership. We know Jakarta Transportation Master Plan is dynamic and sustainable. Therefore, it requires sustainable planning, monitoring, and evaluation that involving multi-stakeholders from central government, like Jakarta Greater Area, we call it BPTJ, under Ministry of Transportation, and Ministry of Public Workers and Housing, Bodetabek Regional Government, and private sector and community, I think. Thank you.
Okay, so apart from what Pak Syafrin has to say, I'd like to remind our audience, if you'd like to ask any question regarding the transportation development of Jakarta and also the Jabodetabek area, please drop your question into the comment or chat section, and we'll ask your question to the intended speaker. I'd like to move on to Pak Jul. So Pak Jul, you have touched on the TOD and the potential of TOD developed along the LRT or MRT line. But can I have your reiteration about the potential of TOD development in Jabodetabek, Pak?
I think the potential is enormous, Pat, because if I'm an investor investing in real estate, where do I want to go now? I mean, it's unthinkable that I would go and build an office block or a shopping mall with no public transport connection, because everybody loves the MRT, and we're soon going to have a longer LRT, the Jakpro LRT. We're soon going to have the Jabodetabek LRT. So developers will more and more want to be near public transport, and you can push them there with regulation, because one of the schemes is, for example, they're allowed to build more floor area if they contribute to public transport. And as long as you don't charge them too much, then their profits are increased by being close to public transport. So there's extra money. Not only is it a good opportunity, but it also puts more money into public transport. If I may just comment on your question about who pays the subsidy, I think there are two other big opportunities in Jakarta. One is electronic road pricing. The scheme has been trialed. It's tried now in many other big cities. I think the car drivers have to pay to subsidize the public transport, because everyone benefits in the long run. The car drivers benefit because there will be less cars on the road if more people can afford to go by public transport. And then there's a further opportunity. We saw from COP26 that soon in the future there will be a real market in carbon emissions. Public transport is one of the ways in which we save the planet, by stopping people driving their cars. And in the future, it will be possible to sell the carbon offsets and plow that money back into public transport investment. We just have to still devise the mechanisms for doing that.
It's really interesting, Pak Julian, but as a private car owner, I would scream listening to your idea. But one of the arguments that private private car owners in Jakarta have in mind is that if you charge private car owners very high to subsidize public transportation modes, how would it be fair if the coverage of public transportation hasn't reached all areas of Jakarta? What kind of model, what kind of balance can you bring to the table, Pak?
Well, let's start with the road charging on Sudirman, because you have the alternative, which is actually much better, and then gradually extend it in parallel. But you say you would scream, Pat, but nowadays you scream when you're stuck in the machete, right? Which scream would you prefer?
You're right.
Paying a few extra rupiah to get there faster, or screaming and going nowhere?
So disincentive for private car owners, apart from charging them for going through Sudirman area or maybe rising the parking fare as the Jakarta Transportation Authority is eyeing to do, or maybe have done that, what else can the government explore?
I think what we haven't discussed in enough detail is maybe the other policies which help to incentivize to plan the city in a better way. So, for example, I mentioned about the new financial center in Canary Wharf that was built on the railway line. If you start with new zoning policies, which actually encourage development next to public transport, then it helps to make the public transport more viable. Whereas the zoning structure in Indonesia is quite inflexible, but I think there's a possible something that can be done there.
Thank you, Pak Julian. So we've got a question from one of the participants via Zoom. As we already knew, this is I think for Pak William, as we already knew that Jakarta is in aim to transform the city to become more sustainable by its transportation system. How do you see the potential of investment opportunities in other sectors, such as TOD, by developing more rail-based transportation in Jakarta, Pak Will?
Yeah, this is thank you. This is will go together, along the process. We are improving the quality of our rail transport systems, our public transport systems, and the potentials of TOD will grow. And because of better improvement in our transport systems, the potential for investing in TOD can also grow. I can show you one example that MRT is working right now. Sudirman, Tamrin, and go to Lebak Bulus, for example, which we have been granted authority to manage the transit-oriented development in five stations. This is a clear examples of improvement of the transport systems. For example, we can see in Block M now, we can see at transit-oriented development. And we actually have some development there, which was actually not invested by the government. Normally, for public infrastructure, it's under a government budget. But we have now some public infrastructures building in TOD areas, which was actually built by private sector. So now there is a very, I said after the pandemic, there is a very good trend that private sectors comes. But number one is we have to do on the homework of improving our integration in public transport systems. So that is the key. Once we are able to fix our public transport and having a good public transport systems, especially along the MRT, the LRT line, and I think the investment for TOD will grow.
Thank you, Pak Will. So we've only got 5 minutes left, gentlemen, and I've got a question for all of you. So how is the potential business collaboration in Jakarta, especially for transportation sector? Maybe you can give, some affirmation, some highlight about this. Maybe we'd start with Pak Shafrin.
I think there are a lot of opportunities for cooperation in the transportation sector, including for the construction of MRT and LRT, as already included in the Jakarta Transportation Master Plan. as well as the supporting facilities such as TOD, transit points and station, park and ride, bike lane and bike share, e-bus, and so on. We will fully assist in the implementation of this target and be able to work together to get the expected result.
All right, thank you. Pak Julian, what is your take about the potential of business collaboration in Jakarta, especially for transportation sectors, Pak?
I think it's good, Pat. I think even though the MRT was basically funded, although it was Japanese loans, but really the risk and the funding was all through the government, the fact that it's been done and delivered shows investors and visitors that what can be done, and that the Jakarta government can be a reliable partner, because there are lots of opportunities, but what investors also want is stability and certainty so that they can plan their investments. And I do think that the climate is improving all the time for that. Of course, people will be worried, okay, what happens when there's lots of elections coming up? But those happen in every country. So I think overall good.
Okay, so about the integration under one umbrella and what we can actually learn from transportation of London, what can you share to the local authorities in integrating all these sectors, all these ministries, all this government into one big umbrella?
I think that there's a saying that the whole can be greater than the sum of its parts, and it's no good each local authority worrying about having control over what happens in its little city, because they have to be able to speak to investors with one voice, and that's what the Integrated Transport Authority needs to be able to do.
Thank you, Pak Jul. Last but not least, Pak William, the potential of business collaboration in Jakarta, especially in transportation sector, Pak.
Yes, the three things. Number one, on constructing the infrastructure. Yes, as we have seen, is we are moving away from very much heavy government investment. For example, now we are looking for building our phase 3 and phase 4 of MRT by involving the private sectors. So that is the first potential collaborations. In the second one is actually in the sector of the operations service. It's not just from the ticketing sectors, but from the non-ticketing sectors. And here I would like to integrate to bring the digital business on this. Yeah, we are having a lot of collaboration with digital business. Yeah, advertising, telecommunication systems. This is all a space, a room that is actually creating opportunity for business collaborations. Yeah, we are just creating our station, which is a co-working space, which is actually inviting business collaborators to come with us. We are working together with so many startups now on business collaborations along the MRT line. And number 3, as mentioned by Julian and Pak Safrin, is actually the transit-oriented development. This is a big opportunity for collaborators, for private sectors to collaborate with the government and with the operator.
Optimism is in the air, gentlemen, and we're looking forward to see a much brighter, much better transportation system in Jakarta, not only for the people, but also for the environment. And there are, this claim or this promise, I think, is imminent, because there's a fundamental policy changes in which car-oriented development to transit-oriented development, and the priority is now given to pedestrians, environmentally friendly vehicles, and also public transport. And as Pak Julian said, there should be disincentive for private vehicles. And last but not least is the emergence of Jaklingko collaboration scheme, in which Jaklingko creates an integration of infrastructure and facilities as well as operational system for public transport. Gentlemen, thank you very much for your time, and thank you very much for your insight, and hopefully the public and the viewers can gain benefits from our discussion. Pak Will, thank you. Pak Jul, Pak Syafrin, have a nice day and stay safe. And next, for the third session, we will talk about urban tourism, the opportunities of Jakarta as an urban tourism destination. We'll be back after the break.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat, terutama pada akhir pekan, seperti Jala Sena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5x15 meter dan dilengkapi 31 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat, terutama pada akhir pekan, seperti Jala Sena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5x15 meter dan dilengkapi 31 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat, terutama pada akhir pekan, seperti Jala Sena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kencik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5x15 meter dan dilengkapi 31 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat. Terutama pada akhir pekan. Seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kensik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 3+1 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Pantai Kita dan Pantai Maju berlokasi sangat strategis. Hanya selangkah menuju Interchange Peak dan Peak 1. Hanya 5 menit menuju Bandara Internasional Soekarno-Hatta. Hanya 1 menit menuju Pantai Pasir Putih Peak 2. Hanya 2 menit menuju Greenbelt 60 hektar. Serta hanya selangkah menuju Raksasa Mall. Mall outdoor terbesar di Jakarta dilengkapi sejumlah fasilitas publik yang sangat menyenangkan dan ramai dikunjungi masyarakat. Terutama pada akhir pekan. Seperti Jalasena, Pancoran Peak, Urban Farm, The Cove at Batavia Peak, Kensik Supermarket, Pusat Sepeda, Sedayu Indo Golf, dan masih banyak lagi fasilitas lainnya. Tersedia tipe lavender yang memiliki 3 lantai, berukuran 5 x 15 meter dan dilengkapi 3+1 kamar tidur. Untuk informasi lebih lanjut, hubungi marketing kami di 021 588 8000.
Mungkinkah ku bayar belanja tanpa sentuhan?
Mungkin dong, hanya HP yang kau sentuh. Bayar belanja tinggal scan QR aja. BCA Mobile membuat semua jadi mudah.
Hidup adalah petualangan.
Halo, Ma. Raffi, obat kolesterol Mama kan habis.
Namun menjaga yang terdekat tetap yang utama. Beli berbagai obat rutin, diantar ke tempat. Tenang, ada Halodoc.
Hi, good afternoon. I'm Hera F. Harin, moderator for this session. Now is the time to discuss our next topic, the opportunities of Jakarta as the urban tourism destination. Urban tourism will discuss about how the government's efforts to reopen investment opportunities, specifically for the tourism sector in Jakarta, the role of the digital industry in promoting local tourism in Jakarta, and potential business opportunities for the private sector and financial institutions to participate in urban tourism development. Through this opportunity, we will get explanation from some great speakers. And then let me introduce all of them. First of all, Bapak Andika Permata as the head of Tourism and Creative Economy DKI Jakarta. Selamat sore, good afternoon Pak. Next we have Ibu Serlina Wijaya as CEO of Pegi-Pegi. Selamat sore, good afternoon Ibu. And then Bapak Adi Satria as Senior VPO Accor Indonesia Malaysia. Good afternoon Bapak. And last but not least, Ibu Novita Dewi as CEO Jakarta Experience Board. Selamat sore Ibu, good afternoon. And for the first time, Bapak Andika Permata, you may start your presentation by now.
Okay, thank you Hera. Good afternoon ladies and gentlemen. Thank you very much for having me in this amazing forum. My name is Andika Permata. I am the head of the Tourism and Creative Economy Department of Jakarta. In this great opportunity, I would like to talk to you about Jakarta as an urban destination and its opportunities for recovering economy affected by the COVID-19 pandemic. Slide 2, please. As we all know, COVID-19 pandemic has made a huge impact on almost every aspect of human life all around the world. The economic and the social disruption caused by the pandemic is devastating, and the tourism sector is no exception. As we can see from the graphic in the yellow line, there is a significant drop on domestic and international tourist arrivals to Jakarta in 2020, which is more than 80%. This is such an unfortunate situation because we all know that tourism is one of the top national income maker in Indonesia. So the government of Jakarta has made some regulation strategies for the economic recovery in general and tourism recovery in particular. Okay, so the strategies made by the government for tourism sector in particular, there are two main recovery objectives that we targeted. The first one is for recovering the tourism-related businesses affected by the pandemic, with the recovery action including supported affected tourism businesses and workers, utilization of technology, collaboration, and preparation of regulation that support tourism industry recovery. And the second one is regarding the trust of the potential tourists have to visit Jakarta in the near future. Actions made for recovering the potential tourist trust are creating the image of safe traveling in Jakarta, facilitate a collaborative tour packages, encouraging business enterprises, and promoting tourism cleanliness, health, safety, environment sustainability, or CHSC, certified destination and businesses. And the next slide, first of all, for the past decade, Jakarta has transformed into a global megacity with state-of-the-art development in transportation, infrastructures, financial technology, and so on. With this development, Jakarta has distinguished itself as one of urban areas with megacity that could offer urban life experiences as a primary tourism attraction, just like other megacities in the world, such as Singapore, New York, Tokyo, Seoul, and so on, with a sense of Indonesia diversity and local wisdom. Jakarta also needs to strengthen its tourism branding due to the COVID-19 pandemic, which has made a turbulence in Jakarta tourism industries. As we can see, this is the vision and mission of urban tourism development in Jakarta. Our objectives are increasing number of tourist arrivals in Jakarta and increasing tourist awareness of urban tourism product in Jakarta, which make our target are increasing regional revenue through entertainment, hotel, and restaurant taxes, increasing economic activities, restoring and conserving the natural, cultural, and historical heritage. Jakarta offers integrated accessibility to and from major transportation hubs like airports, MRTs, bus stops, and train stations to hotels, tourism destination, and all districts in the city. The integration here refers to integration in infrastructure, so tourists could change to different mode of transportation effortlessly. And integration in payment, so tourists merely need one card, Jaklingko, to pay all of transportation modes in Jakarta. Jakarta offers diverse tourism destination and attraction, starting from the beautiful nature and tropical resort 5 in Kepulauan Seribu, historical areas of Kota Tua in northern Jakarta, shopping, Vaganza in western Jakarta, various sport activities in eastern Jakarta, including golf, cycling arena, horse riding, museums, urban park, and emerging creative district in central and southern Jakarta. Jakarta also offers whole year's event that tourists could visit like Java Jazz, Jakarta Film Week, Jakarta Fashion Week, Indonesia Contemporary Art and Design, and many more. Especially for the investors, Jakarta offers wide range investment and endless opportunities in 13 tourism sectors. Based on the regulation, for instance, F&Bs, MICE, spa, hotels, and so on. At the moment, Jakarta is currently developing several projects and soon ready for investment such as Ragunan Zoo, Ancol Amusement Park Improvement, Kepulauan Seribu, and Kota Tua Adaptive Reuse. Now we are talking about the placemaking of urban tourism in Jakarta. Next slide, please. Okay, as shown in this slide, placemaking here has a meaning where space like buildings, public spaces, and areas combine with meaning or the addition of public activities and activation. These two will create a quality of place. For example, area in Duku Atas such as spot budaya Duku Atas and Terowongan Kendal where the community can utilize the space for their activity. And for placemaking marketing method, the collaboration with all stakeholders such as association and communities, vlogger and blogger, private sector including startup or media digital company, also digital marketing are needed. We can use the public space for many activities and events, not only for tourism, but also creative economy which can be adjusted. Therefore, Jakarta offers wide range investment and endless opportunities to develop urban tourism in Jakarta. Finally, we are at the end of my presentation. Hopefully, we can learn something new and this will be beneficial for us all. Thank you so much.
Thank you, Pak Andika. Very insightful. And yeah, talking about Jakarta as one of the largest megapolitan, like you said before, and of course, if we talk about the purchasing power in Jakarta also as the hub of business, the hub of trading, I think Jakarta is one of the sexiest city to come to. And if you mentioned before, after COVID-19, it's trending down, the tourism more than 80%, and hopefully after this become well managed, I think it's going to be better for Jakarta urban tourism for the next time. Like you said, from Pulau Seribu to Kota Tua, like I always ask my daughter and say to her that 365 days won't be enough for you, to enjoy Jakarta. Thank you for your insightful presentation, Bapak Andika. Now we talk about the Jakarta that dominates in terms of transaction, especially from e-commerce using e-wallet. Now let's hear more from Ibu Serlina Wijaya as CEO of Pegi to talk about that transaction. How is it going? Is it now going better after the well-managed of the COVID-19 case and the vaccination rate is going to be better? You may start your presentation now, Ibu.
Okay. Thank you, Ibu Hera, for the very good introductions, and good afternoon to everyone. First of all, selamat sore, and my greeting to the Honorable Governor of Jakarta, Bapak Anies Rashid Baswedan, to all of my fellow speakers today, Bapak Andika Permata as head of the Department for Tourism and Creative E-commerce, and then also for Bapak Adi Satria as the Senior Vice President of Accor, and for Ibu Novita Dewi as the Chief Executive of Jakarta Experience Board. So I wish all of the participants today, and also to all of the future investors, as well as the participants today, ladies and gentlemen, good afternoon. So wishing all of us here a great health and safety, especially during this pandemic situations. So for today, I'm very excited and I'm very thankful to be invited by the Pemprov Jakarta to be able to share some view on behalf of a travel industry player about how is the entire Jakarta as a tourism destination in Indonesia, leading tourism destination in Indonesia, and how is the recovery that we see that we can really contribute together as all of the ecosystem players. I do notice that Jakarta Investment Forum 2021 is a very significant event. So not only significant event because Jakarta holds a very strategic position as the capital city of Indonesia, but also Jakarta as the economic hub, the financial center of Indonesia. And soon, as we all wish Jakarta to be the leading urban tourism destinations in ASEAN. So allow me to introduce myself. I'm Selina Wijaya, Chief Executive of Pergi-Pergi. So Chief Executive Pergi. Pergi-Pergi is one of the leading online local travel agent in Indonesia. So if I may share a bit journey about Pergi-Pergi, right? So we started all of our operations and business since May 2012, whereby we launched the hotel bookings. And 9 years after that, in the 2021 today, we already have all leading transportations and accommodation solutions within our platform, consists of not only hotels bookings, but also transportations booking like train, flights, and also bus. We have connected to thousands of supply routes all over Indonesia and also in Southeast Asia and globally on behalf of our transportation business, whereby for the accommodation, we managed to connect to more than 10,000 hotels in Indonesia domestically and also in the region. So footprints of Pergi-Pergi, we have offices that is spread across all Indonesia in 5 major cities with Jakarta as the headquarters. So now come to the main topic of the discussion, which really excites me the most, right? So I think even in startup, normally we do have we call it $1 billion questions. So I guess today the $1 billion questions is really how all of us as the ecosystem players in Indonesia, travel ecosystem players in Indonesia, how do we really bring and elevate Jakarta to become the next leading tourism in Southeast Asia, in ASEAN? Or in another words, perhaps we could say, how do we become the next Singapore of ASEAN? How do we become the next Tokyo and the next Seoul of East Asia, right? So I want to share some of the view on behalf of the travel tech players today. And as we can see, the potential, the potential of Indonesia in the entire travel market. Indonesia is now really taking a leading role to become the digital economy powerhouse in Southeast Asia. This is actually thanks to the bonus demographic that we have. Majority of Indonesia populations consists of younger generations. It's either millennials or Gen Z. So this has really translated into the numbers that we see here at the right side of the presentations, that 70% of online penetrations, online transaction is already happening in Indonesia across all sectors. And we can see here as well, actually, travel and tourism take a very leading part. Although there are slight contraction in the entire economy due to the pandemic in 2020 and 2021, but based on the projections that we do very closely together with all of the research agency nationally and also globally, actually we do notice that by 2025, the entire internet economy for Indonesia is projected to become $124 billion. So that's actually a very huge number. And if we see what are the major contributors to that numbers, one of the leading sectors is really on the travel and tourism. So this is to highlight how big is the potential for travel and tourism for Indonesia in this particular momentum where digital has really become something that is really huge globally, regionally, and even nationally. And thanks to the pandemic, so pandemic I think brings lots of opportunities, right? So if we take a look at by June 2021, in terms of the recovery rate for domestic traveling, we have reached at the figure of 48% for the domestic travel. And in case we zoom in to some of the destinations, right, we actually have some emerging destinations. Jakarta remains top demand by destination city. This these slides, actually, the entire information in this slide is based on the transactions data that we gather inside Pergi-Pergi itself, representing all of the region across Indonesia. So some of the major city, the insights here is that some of the major cities like Jakarta, Bandung, Yogyakarta still take a leading part in terms of the destinations, but we do notice that there are several emerging cities that we have never really thought before, like cities in the second tier, third tier, and so on. So what does this slide tell is actually really show us the big opportunity that Indonesia will have, not only nationally, but also if we can expand it to regionally, the domestic leading tourist destinations that we really have and possess. And if we move to the next slide, but then what are the things that we need to prepare, right? On behalf of the industry players, we need to ensure that now every visitors, every tourist, every customers, the behavior has really shifted. For example, there are interesting findings inside Pergi-Pergi as well. We noticed that prior to the pandemic, actually most people, especially in Indonesia, they are very price sensitive. So even if the price has a difference of around 2,000 rupiah, 5,000 rupiah, people will easily switch online travel agent. But then we noticed that during the pandemic, and then in the post-pandemic new normal world, actually the concern of the price still matter, but the growing concern of people, number one, is really centered around the safety and health. So it's no longer only price, it's no longer in price sensitivity, but it's also about the how do we mention this? The cleanliness, the health protocol of a specific destinations that they are going to visit. And then secondly as well, in Indonesia, normally people are very last minute. So we also did a research across all cities, all region in Southeast Asia, not only Indonesia, but also Malaysia, Thailand, Philippines, Vietnam. Indonesia is number one in terms of the last minute booking. But there are emerging behavior that are actually also interesting is that people now plan earlier in this situation, in the pandemic situation. And then the third thing that is also interesting for us is normally Indonesian people like to travel to visit malls a lot. So this doesn't mean that malls has lost its attraction. Malls is still very attractive, but then we noticed outdoor tourism spots and beach, such as beach resort, is really growing in terms of in the new normal behavior like this. So moving on to next, what is the really path forward, right? The path forward is the key message here is very clear. Indonesia actually has many potential, has many destinations to be promoted. The destinations here in a couple of years previously, perhaps it's only centered around the first tier city and second tier city. But now things has changed thanks to the pandemic as well, to the extent that Indonesia now not only the first tier, second tier and third tier and beyond that actually has a lot of potential to be promoted too. But if we are to talk about Jakarta specifically, right, what is the path forward? The way I see it, Jakarta has a lot of interesting and attractive local tourist destination. I think this is really thanks to the Pemprov DKI Jakarta, who has done a lot of great effort and strategy to really make sure that we are leading in terms of the tourism spot. But based on the study that we conducted internally together with several agencies as well, in terms for us to really promote a specific destination, there are three leading pillars. At the very center of it, a destination needs to have the soul. A destination needs to have a very compelling vision, a very compelling story. I remember when I was at a younger age, I do visit Singapore, right? In Singapore, previously, they don't really have a story. We just know we go to Singapore because our parents go to Singapore. But now, even when we are here in Jakarta, we do see a lot of campaign about Singapore. For example, telling about, for example, Singapore passion made possible. And then when we travel to Singapore at each of our touch point, we also see the campaign. They really tell about the core stories of the destinations. I think that is the leading thing that we have a big challenge, and a big homework for us to do as all of the ecosystem players. The challenge is also, I think the next question is also how to make sure that we can make Monas to be able to become the next, for example, Tokyo Tower of Tokyo. How do we able to make Dufan to be able to become the next Universal Studio? So the idea here is the one that needs to become the top of mind is not only the city, but also some very interesting spots even within the city itself. So the stories become something that is really powerful. And then the entire strategy and roadmap about developing the destinations and destination marketing will be centered around that story, that compelling story and that compelling vision. And here we also do some research to see what is the thing that are really crucial, right, for us as the entire ecosystem players to play along, to make sure that we can promote Jakarta and other local leading tourist destinations. Making sure that we target the right visitors are key, are very crucial. But in case we are targeting specific visitors, then our journey as all the industry players is to make sure that we really understand who are the target audiences. And after understanding them, we need to know the entire journey. The journey here doesn't mean journey when they visited our country. The journey has started even earlier, starting from when they are not aware yet of other destinations, starting from when they consider their planning to a specific destinations, starting from when they arrive in the specific destinations, and after the post-traveling, they enjoy the experience very much. They have a superior experience, and they be able to really become advocate organically, and then organically becoming a repeating visitors to our destinations, and also tell their parents, their relatives to also visit us. And the key enabler here, the way we see it, is really collaboration among all players: central government, local government, financial institutions, service providers, technology platform like online travel, e-commerce, financial technology, and so on. Also include investors and the citizens itself. And how do I see the central role of technology company is that we can really contribute and supporting government in each of these stages, meaning awareness stages to be able to make sure that we convey the message, we convey the story about a certain destination that we are targeting on behalf of the government. Second is also to be there providing a lot of information to help with the decision making during the during the consideration and planning phase, and then also to be able to become enabler when the visitors arrive at the destinations, experiencing the destinations, and also to have spread the news when they have become the advocate. And here, the key is really on destinations marketing, whereby as the technology players, we can push the story, the branding of the specific destinations, bring that into the awareness of the target audiences, push them into converting, and then making sure that they visit our destinations, have a superior experience there, and become the advocate. And this highlighting some of the Jakarta and the leading tourist destination. We know Jakarta has lots of places, right? As Bapak Andika mentioned earlier as well. We have Monas, we have Taman Mini Indonesia Indah, we have Museum Nasional, we have Ancol, we have Safari, we have malls, we have beaches, we have many more things. And how do I see the entire role of each of the players that we need to play is that when a tourist visits a destination, then the destination needs to be well developed. And what does well developed mean? We did a quite extensive research in the years previously, and we have come up to the conclusion that actually when a visitor do visit a place, a destinations, these are some of the crucial things that they will be doing. The first, they will do research to know, okay, what are the activities that they should be doing in that specific destinations. Second, obviously, they need to mobile. Then transportation becomes something that really matters. Third, they need to stay in a hotel, right? Fourth, they need to visit some attraction places. They need to eat. So that's why restaurant booking platform becomes something that is really crucial. And they need to be able to pay out of that payment platform. And not only that, in these new normal situations, they also need to make sure that all of the safety, health concern, we are able to track the journey, the visitors. And that are the entire thing of the business that I see already running. We already have technology solutions for that. But I do notice that the opportunity is not only on that side, but also on the things that is not yet established. For example, government of Jakarta, Pemprov Jakarta might have some visions related to how should we promote Jakarta in the future. So based on that vision, certainly there are things that needs to be enabled within the city, right? I remember, for example, when I visit Taiwan, they do have a public bicycle and they do have a public locker whereby the tourists can be very convenient to shop around and then can place their belongings in the locker, right? So that are only the examples. So the message is that the solutions, the needs will be based on the vision that the government wanted to craft in a specific destination. Then let's really promote all of the tech players to become the enablers of that. And tech players also cannot do this alone. We need investors. Investors mainly normally for two things, two major supports that startup will need. The first is obviously on the funding. The second is obviously on the know-how, because investors normally have a lot of global practices that they can bring into Indonesia too. And on top of that, not only investors, we also need a collaboration with government to make sure that all of the regulations are smooth and to make sure that the vision and the master plan is there for us to be able to help execute. Yeah, so that's the example, and here I'm sharing some quick example on the Pergi-Pergi and Wonderful Indonesia Kemenparekraf collaborations, where we do really help government of Indonesia to promote a certain specific destinations. We create a campaign in this new normal pandemic situations, and then we also help spread the news through all of the channels that we have. And we also bring that collaboration further, not only between Wonderful Indonesia with Pergi-Pergi, but also with the other many partners that Pergi-Pergi have. So it becomes a multi-partnership. Yeah, so that's all from my side. I do believe that Indonesia now is really at the very momentum of a leading digital ecosystem, digital economy of ASEAN. And then Jakarta strongly has the benefit of that because we are the capital city of that, of Indonesia. And now the next big challenge and big homework for all of us is that how do we really bring the collaboration among all of the ecosystem players, not only tech companies, investors, financial institutions, local service providers, local people, alongside with the government. I think to really realize the vision of Jakarta to become the next top of mind of the tourism destinations, not only in the ASEAN, but also globally, not only for leisure, but also for business purposes. So that's all from me for today. Thank you.
Thank you so much for your great sharing, Ibu Serlina Wijaya, the next top of mind, not only for Asia, but of course, globally. And all participants, let me remind you to book your one-on-one session with Jakarta policymakers in Meet the Leaders session at November 15 at 9 to 11 a.m. Waktu Indonesia Barat. And I think what Ibu Serlina shared is very interesting. And of course, she also shared about the latest research from Google, Temasek and Bain, sharing how big the opportunities for Indonesia, for the economy, especially going digital. I think what Ibu Serlina shared is about the well-planning tourism ecosystem, collaboration between stakeholders is one of the key. We do it together, you know, like in recovery, economy recovery after COVID-19 or post-COVID-19. Thank you so much, Ibu Serlina. And all participants, don't forget to scan the QR code down below for the chance of winning free voucher from Pergi-Pergi. I think it's very interesting because everybody, I think it's too long being in home. And next, let's hear more from Bapak Adi Satria as Senior VPO Core Indonesia Malaysia. Bapak, kami persilahkan. You may start your presentation by now.
Thank you very much. Good afternoon, everyone. Pak Andika, good afternoon. Ibu Sherlina, Ibu Novita Dewi, good afternoon. My fellow speakers, audience, good to be able to share what we have done so far and in the future, what is our plan also. Because, you know, Accor has been around Indonesia and it was about almost 30 years ago. We opened our first hotels in Jakarta at that time, when we actually, as a group of hospitality company, enter Indonesia. If I could go to the first slide, you could have a look here. Accor, it's a hospitality company with a different vision these days. we are augmenting different type of segmentation in order to be able to survive in this current pandemic situation, and moving forward also moving outside the pandemic. It's a hotel company that have 51 brands around, and we actually working on 40 hotel brands. So the other 11 is in fact what we call an augmented brand. So it's more than a hotel brand, but it's also a brand where we actually really working on entertainment, lifestyles, and also different type of restaurant and food and beverage. If we go to the next slide, we could actually see the footprint of Accor. So in Jakarta itself, we have around 34 hotels. We're operating from a brand of Raffles, Fairmont, Pullman, also Swiss Hotel. It's a new brand that we actually brought in to Indonesia. We opened the first one in Jakarta just before the pandemic hits, in fact. So it was definitely a new experience for us, opening a hotel throughout this pandemic situation. If we go to the next slide, we could have a look. This is where Accor today. So it's more than just a hotel company. It's a broad ecosystem of brands and solution. It's what we call an augmented hospitality. It's a new way of living, entertaining, and accelerating business, what we call Live Limitless. So, you know, if some of you are a fan of PSG, for example, you could see our major sponsorship there. And our ambition in there is about creating tomorrow hospitality. So we always look at ways to adapt, to have different type of approach in different region, different area. We look at how we could innovate better. And this is actually, certainly throughout the pandemic, it has brought us to a different level of innovation in order to actually survive the situation. If you have a look at on the next slide, also, this is where actually our tagline or ambition come into play. So what we call now today, all Accor Live Limitless. So we combine all the different experience from different brand, from luxury segment to premium segment to mid-scale segment to economy segment, right throughout the whole brand. And we're combining also a what we call entertainment that we would have in terms of lifestyle. So we're slowly bringing the different type of elements in terms of experience to the actual brand. So it's more than just a hotel stay. When you actually come and stay in our brand, you actually live and breathe a different experience. If we go on the next slide, you know, if we start a little bit, you know, to combat or to anticipate of when we had the pandemic, you know, at that time, we just finishing the closing of 2019, our what we call our financial book, and being a public listed company, we actually have what we call a dividend period. So at that time, our global, you know, shareholder, stakeholder actually decided when we, at that time was just the beginning of the pandemic, it was in April 2020, not to release the dividend. Instead, we actually working to innovate our team throughout the world that have difficulties, lose their job because of the pandemic. This is what we call the Heartist Fund. So it's a solidarity definitely at the heart of Accor. And this is where we said it's more than just a hotel business. We actually look at different things. At this time, you know, all of our hotels were struggling because of the economic situation. So from was doing well in January, February, when we come to April and May, really there was nothing in the hotel at that time. So the shareholder at that time allocate 70 million euro exactly. And so far, it's been 20.5 million euro has been given to over 75 or almost 74,700 applicants over 12 countries. So this is a major, I would say, changes that we've done in order to make sure that we could bring our team member to the, obviously, to the end of the crisis that we would have. On top of the Hearties Fund, if you go to the next slide here, the different innovation that we actually work on together with the many government in the countries, it's about our standard. So it's how to bring the client back to trust, to a certain level of trust where they are able to come back and stay in the hotel. At that time, we work on our cleanliness and prevention program, what we call All Safe. If we go to the next slide, so what is All Safe all about? It's basically one of the most stringent cleaning standards and operational procedures in the world of hospitality. It's to ensure, basically, we work with Bureau Veritas as a third party here, and it's to ensure basically all of the standards in terms of cleanliness, safety, and all of the different regulation within the country, it's being adhered to. So, and this program is really tied up with the CHSE of Ministry of Tourism and Creative Economy that we have as a certification also within the country in Indonesia. If we go to the next slide, you could see here the 16 different commitments. So it's not only commitment for our guests, but it's also for our Hearties or our team member. We call it Hearties in the core. So it's underlining to ensure that is when you actually come and stay with us, you could really feel that it's safe, and you could really see the different aspect in there. So give you an example, it's the All Safe officer that is available 24/7 at the hotel to ensure that, you know, the standards and the implementation is being implemented accordingly outside the period where we actually have the unannounced auditor come in. The extra, obviously, mask and sanitizer available for our team members and our guests. The safety and hygiene extra training that we've done. The extra room disinfection, the different regular health check for our team. At that time, we started with PCR tests because it was the only one available at that time. So we go through all that different mode of commitments in order to ensure, and it still does until now, and we are just going to 2022 now. So all of our hotel is being re-audited accordingly, and also to get also the same renewal for the CHSE to ensure that it's actually being followed through accordingly. And All Safe, if you go to the next slide, it took all the different references from the Ministry of Health in Indonesia, work closely with the creative economy, the Jakarta government, the different local government throughout Indonesia, because we operate in more than 30 province and area in Indonesia. If we go on the next slide, you know, one of our different mindset as we move forward towards this pandemic situation, we actually work a lot in collaboration with the government and the different protocol in Indonesia and stakeholders also. So we actually change the way we present our food and beverage. We work closely with the local SMEs or small businesses. We endorse all of the program of the government, Bangga Buatan Indonesia, Beli Kreatif Lokal. So all of this, I would say, program that the government would have, be at the national level or at the province or local level, we work closely together because it's crucial for us, not only for the hotel itself, but it's important for us to be able to grow together within the community and to support the community within the hotel where the hotel is to ensure we can come out together from this pandemic. So that's a big, I would say, different perspective that we took, and we work with different ministry in there. to ensure that we could survive together. So it's not about standalone, it's about togetherness, it's about working closely, it's about collaboration for us with all the different stakeholders, be it the government level or the private sector or the small businesses that we have available within our hotels area. If you go to the next slide, it's a concrete, so it's not only on the paper. So these are some of the examples that we work on for the Batik National Day. We work on with the Jakarta government also in terms of the vaccination and masks together. We work on with the Ministry of Trade, Ministry of Small Enterprises and Cooperative, Ministry of Agriculture. So the different level of, I would say, close collaboration, we actually step it up in order to be stronger, and it's also to support the whole ecosystem to be able to grow and to be able to support each other in order to survive from this pandemic. And moving forward, this will be a continuation of our strategy, because we can see the impact. We can really see the impact when we actually work together, and we can actually come out from the pandemic together. And the success is definitely there. Few of the different example today is the cooperation that we work with the small businesses. That's actually working together, because we could have a story. I mean, one of my colleague just spoke about the story. So we would like to have that story within the small businesses that is available, that could translate, where is the produce or the product come from that comes to the table when you actually order a different food in our hotel. So it will be good for our guests, and definitely it's well appreciated to have this story for them when they actually dine in our hotel. If you go to the next slide here, you could see the collaboration also with the stakeholders, with the government, with the Satgas, in order to assist during the pandemic time. And until now, we have a lot of hotel being used for repatriation. We have a hotel before was being used for the medical. And now we work together with the Ministry of Tourism to have our hotel being used for a staycation program. That was given as appreciative for all of our heroes, our medical heroes that have assisted us throughout the pandemic. If you go to the next slide, we also launched a unique 360 integrated campaign called Rediscover Indonesia. And every region would have one. Definitely Jakarta, throughout our hotel in Jakarta, is a key theme there, because majority our hotel it's in Jakarta. So it's about combining what I mentioned earlier of the story, the different story in terms of the levers of the program. So we have an element of, for example, wellness. We have an element of experience. We have element of the restaurant and bars in this program. So it's not just a discounted program, but it's a value-add experience program where we have launched that to all of our members. We have about 2 million members in Indonesia, and certainly this will be a key for us to promote the traffic, the travel domestically within Indonesia. And Jakarta being one of our key hubs, it certainly helped the stakeholder and the hotel and the stakeholder around the hotel in each of the province, each of the area as we launch this program forward. If you go to the next slide, so this is the, I have mentioned this earlier, it's about domestic destination, and this program, it's about supporting the initiative of the Indonesian government in regards to a program of Bangga Buatan Indonesia. It has a nature, art, culture, and different type of wellness in terms of the elements of the campaign. If you go to the next slide, we launched the program. It's a CRE program, and we launched it right through the different elements of our levers. So that's there our membership program throughout Accor Plus. There's this program also in our loyalty member all. We have it also, and the stakeholder obviously with the different government support, the support of the community and the partnership that we would have. If we go to the next slide, these are some of the obviously activation that we have in the hotel also. It's some of the, we call it fair for the small businesses, and we're running around throughout the country to have this. So we just did one last week. It was a big one that we did in Surabaya. We've done a few months back, it was in Jakarta. And we're going around throughout the region to run this. Of course, you know, with a sound measure of health protocol to ensure that there is no clusterization in our hotel with all of this trade fair that we would have with the small businesses. So from the food, from the wellness, from the art, from the culture. So we work closely with everyone. So that's all from Accor. It's what we've done so far and what we are looking at and eyeing all together for 2022 in order to support the tourism coming back post-pandemic, COVID pandemic, hopefully. Thank you very much. Good afternoon, everyone. Wassalamualaikum warahmatullahi wabarakatuh.
Yeah, Waalaikumsalam. Thank you so much, Bapak Adi Satria. Very excited to hear some of your initiatives through the hardest time Accor has done and keep doing at the moment. You know, like I noted here, like you put elements for experience and you want the customer feels more than just a hotel. I think that's very, very interesting. And the heart is fun, you know, like showing the empathy and action to your employees. I think everybody's talking about that now. And then the new normal, 16 level commitment, you know, with the hashtag all safe. And last but not least, you also mentioned about collaboration. So I think I heard several times my panelists talk about the collaboration. And I think we'll see how's in the next discussion, how is it going to be implemented in Jakarta to be the urban tourism. Well, now let's hear more from my next panelist, Ibu Novita Dewi, as CEO Jakarta Experience Board. Ibu Novita, you may start your presentation and we'd love to hear from you, please.
Thank you, Hera, for the time. First of all, I would like to express my gratitude for Jakarta government for holding such an amazing event, especially to Governor of DKI Jakarta, Bapak Anies Baswedan, and also Head of Department for Investment and Integrated One-Stop Service DKI Jakarta, Pak Beni Agus Chandra. Good afternoon, Pak Andika Permata as Head of Department for Tourism and Creative Economy DKI Jakarta, Ibu Serlina Wijaya as a CEO of pegipegi.com, dan juga Pak Adi Satria as a SVPO of Accor Indonesia Malaysia. Good afternoon, everyone. Thank you for giving me this opportunity to share from our perspective as the regional state-owned company. In this opportunity, I, Novita Dewi, as a CEO of Jakarta Experience Board, I would like to share the changes in tourism and creative economic industry in Jakarta during pandemic and how Jakarta Experience Board respond to this kind of changes. Here we are looking at tourist visitation data in 2020 and 2021. The orange figure shows the number of foreign tourist arrival in Jakarta decreased by 74.33%. In January till June 2020, there were around 3 million visits, while in January till June 2020, there were only around 800,000 visits. The data is based on Badan Pusat Statistik. Then the blue one described a tourist visit to the capital city of Jakarta in January till July 2021 decreased by around 82.9%, or only around 64,000 people compared to the same period in 2020, which reached around 377,000 tourists. The factor that caused the decrease are the social restriction implemented by the government, and also the closing of tourist destination or department store and so on. The COVID-19 outbreak is changing people's sentiments and priorities, especially in time of new habit. Society still need to have vacation, but the outbreak of this pandemic has changed people's behavior in a various way, including the way people travel or access entertainment. Firstly, go virtual. With so many restrictions and mobilization, people tend to access entertainment through virtual media. And then secondly, stay at home. Stay at home creates a lifestyle that makes the home a center of activity, whether for work, rest, or vacation. Thirdly, health and sanitary. Pandemic makes a person more attentive to psychological needs such as food, hygiene, safety of the body and soul. So while on vacation, you will pay great attention to health and safety standards. And the last is the outdoor activity. Pandemic is also bring a new interest in outdoor activities as an alternative entertainment. Well, to respond to the pandemic outbreak and the shifting of the nature and the tourism sector, we decided to make transformation. In 2019, we suffered 4 years consecutive loss. We operated only in one hospitality sector. The image of our company was conservative and rigid, and more than 70% of our employees are not in their productive age. The employees are above 45 years old. Thus, we need to transform the company by optimizing our asset. When the pandemic occurred, the hotel occupancy rate was very low. Then we optimized the asset by providing accommodation for the health workers. We boost our F&B businesses to operate by collaborating with e-commerce platform. We offer early retirement program and successfully lowered the operational costs. And by doing this, we finally gained profit after 4 years consecutive loss. And we also expand the business, adjusting with the industry need. We have, at this moment, we have 3 core business, such as hospitality and tourism, creative economy, and city beautification. We changed also our brand into Jakarta Experience Board. We rebrand the company to be more vibrant, flexible, and dynamic. And finally, we also improved the quality of human resources by hiring young and creative people so that we can create a lean organizational structure. We do believe that vaccination become one of the efforts to recover the tourism sectors. If we look at the data, until November 11, 2021, DKI Jakarta has distributed more than 10 million doses of vaccine for the first dose and more than 8.6 million doses of vaccine for the second dose. And JXB also contribute to widen the vaccination coverage through collaboration. We held various vaccination centers, such as vaccination center with Sarana Jaya, with Stellar, with Hipmi Jaya, with Inayes. Also, we helped the Pemprov DKI to make the concept of the mobile vaccine. So JXB has organized various vaccine centers with total distribution of almost 15,000 doses of vaccine. The next is about MSMEs. Micro, small, medium enterprises play important role, of course, to drive economic cycle, as there are around 65.5 million MSMEs in Indonesia. And based on Badan Pusat Statistik data, MSMEs are able to provide up to 119.6 million workers, or around 97% of the total Indonesian workforce. We collaborate with Jakarta government and private sector, present Jackpreneur Fest as a program to increase MSMEs' capability through training programs, support, marketing channels, and product sales. We also hold appreciation programs and also business competition. And through the programs, MSME can increase its ability to be more competitive. And as the situation is getting better, as many as 84.8% of MSMEs in Indonesia have returned to normal operation in March till April 2020, based on Mandiri Institute. Next slide, I would like to tell you about the pandemic, that the pandemic caused the shifting of demand in a tourism sector in a new normal business. So it is important to capture new opportunities during this time. Firstly, hospitality and crisis. During the pandemic time, the demand for versatile hospitality and crisis is very high, especially during the peak time of the COVID-19 outbreak. We need to be fast, accurate, and careful. So based on the instruction of Governor of DKI Jakarta, Pak Anies Baswedan, we provide accommodation for health workers for more than 1 year in 6 of our hotels. And also JXB become the first hotel provider that manage hospitality related to COVID-19 crisis. JXB becomes a benchmark for every hotel that intend to offer similar services. Because of that, we are also now pointed to collaborate with central government and Jakarta government, and also regional military command Kodam, and also BNPB to provide accommodation for COVID-19 patient in Rusun Nagrak, Wisma Atlet, and also Rusun Pasar Rumput. Next is the high demand of the hybrid event. Since there is social restriction, music, performance, conference, and any other event is held online and also offline. So I will elaborate about this event in the next slide. And then thirdly, pandemic boosts more outdoor activities, so that we need to activate more public places. And the last is the implementation of CHSE, or Clean Health, Safety, and Environment Regulation in hospitality. Well, JXB made various breakthroughs by collaborating with many collaborators to create creative programs that were able to adapt the pandemic condition. These programs contribute to recovery of the tourism sector and creative economy industry. Collaborate with some parties such as Berlian Entertainment and also Spark from Lipo. JXB become the pioneer to help new normal business through drive-in cinema and drive-in concert. And through JDCN Forum 2020, we also organized virtual international forum that discussed collaboration to recover Jakarta's situation after the pandemic. The event was viewed by 1.4 viewers from 38 countries and attended by 42 national and international speakers. And last, to celebrate the ambience of Ramadan, we also organized virtual tour Ramadan and also virtual Ramadan Jazz Festival. Jakarta Experience Board planned to create several tourism products and programs to take the advantage of the existing opportunities. The product and program are adaptive to the pandemic situation and are also able to create new travel choice trend. First is health tourism. Health tourism is a tourism package that facilitates tourists to get vaccinated during their visitation to the city. The objective of the program is not only for the commercial aspect, but also to encourage the recovery of tourism industry and vaccination program. And then GV Kota Tua shareholder agreement will be held to strengthen the commitment to revitalize Kota Tua and also Sunda Kelapa. City Exploration is a program that invites the society to explore Jakarta as an urban tourism destination, both through virtual and in person. And also, Jakarta Experience Board, we will revitalize all of our hotels. So Jakarta Experience Board, as the owner of the promising Grand Cempaka Business Hotel, will bring a new image of the hotel with a touch of Batavia in the design. Grand Cempaka Business provides a new experience with a nostalgic ambience. And yesterday we signed MOU with Tauzia Management Hotel, collaborating with Tauzia as a professional hotel management. Grand Cempaka Business is committed to deliver high quality services and ready to support Jakarta tourism industry. And for the street kiosks and bike lanes, this one is our project to activate public spaces. We develop public space to be a tourist destination, equipped by tourist information of Jakarta and vending machine that sells Jakarta souvenirs. Boost more outdoor activities by providing facilities for public. In Jakarta International Stadium will be soft launch on December. We collaborate with Jakpro and also Pancoran Soccer Fit to hold an international event in order to initiate JIS as a new tourism icon in Jakarta. On April 26, 2020, GXB, MITG, and also ITDC signed an agreement to build GV Kota Tua. This GV Kota Tua will be the operator that develop the new phase of Kota Tua. We hope to create Kota Tua as an integrated historical and cultural tourism area that is pedestrian friendly and has high economic value, optimizing the strengthening of the characteristic of existing historical value and also developing an integrated area with intermodal transit facilities. The development of the Kota Tua itself will be based on 5 pillars: education that include heritage, cultural studies, tourism, creative economy, technology, and innovation. We expect to organize cultural entertainment, build thematic destination to bring historical experience to the tourists. And the infrastructure will be prepared to accommodate international events. Then during the development and activating the area, we will collaborate and engage with local community. Next plan, we are going to have shareholder agreement to strengthen the commitment. And we are very open to any collaboration for investors, collaborators, or any to develop Kota Tua in order to realize Kota Tua as a world-class tourist destination. That's all from me. Thank you very much, and let's collaborate.
Thank you so much, Ibu Novita Dewi. You talk about the Kota Tua. 2 weeks ago, I visited Kota Tua with my family, and it was very, very excited. You know, like it's such as a one-stop tourism concept. You know, like you said, it's a world-class concept. It's very true. Like you know, if you put your kids over there, you can get you can take them to the historical museum, and it's very, very excited there. Thanks a lot, Ibu Novita. And regarding to your explanation, I put some notes. You know, like now I think the visits of the tourists now it's more than 4 times surging at the moment to Jakarta since first wave of a COVID-19, if I'm not mistaken. And then you talk also about the transformation that you and team did. And then you know, like the vaccination rate, I think already, you know, like it's already more than 100% for first dose, and then almost 100% for adults for the second dose. I think it's a good number for us. And of course, you talk about the MSMEs, and this is a very interesting one. Demand is normalizing, not only normalizing, but also shifting. And that's why hybrid event, I think it's going to be very interesting for the next urban tourism in Jakarta. Thank you so much, Ibu Novita, and thank you to all of the speakers, all of my panelists for the very interesting explanation, and of course the insights from yours. And okay, now it's time for the question and answer session with all the participants here. And I would like to remind you, the viewers watching at home, that if you have any questions, you could write down or just drop your question on the chat room box, and we're going to ask your question to all my panelists. Of course, with the limitation of time, I think we're going to choose some of the questions, but thank you so much because you've been so enthusiastic joining this event. So I think while we are waiting for the question from all of the participants, I think I'm going to go to Bapak Andika Permata. Pak Andika, we are currently still in the post-pandemic situation, if we may say that. And how are the government efforts in restoring the tourism sector in Jakarta to attract more local and, of course, foreign tourists? And what kind of initiative that you're going to offer to the investors, to you know, like from to the citizens, of course, to all of the stakeholders? Bapak Andika, please.
Okay, thank you, Hera, for the question. Before I answer, first, I would like to greet my fellow speaker. Hello, Ibu Serlina Wijaya, Bapak Adi Satria, dan Ibu Novita Dewi. I hope you are all in good condition. Looking forward for us to meet in person to discuss for the tourism development, right? Okay, so right now, Jakarta has strengthened the implementation of CHCE certificate, crowd control, and COVID-19 safety protocol. Based on our data, we have 1,721 hotel, restaurant, and cafe that has been certified with health protocol, or CHSE. We also have 12 quarantine accommodation for foreign tourists and 55 quarantine accommodation for domestic tourists, to make sure that the tourists and visitors are safe to explore the vibrant life of the city. We are also deploying several city tours program with collaboration with stakeholders of the city, exploring the unique perspective of Jakarta citizen. For example, we had a collaborative event exploring the city, particularly around Cikini area with Jakarta Experience Board. And of course, we also expecting future collaboration with other stakeholders, Pegi-Pegi and Accor, of course. Right now, as we know that the COVID-19 cases in Jakarta have dropped, and thankfully now we are on level 1. Therefore, the provincial government of Jakarta has carried out a gradual opening of 18 tourism-related businesses by implementing strict health protocols. We are hoping those actions will restore the potential tourist trust, whether domestic or international, to travel to Jakarta.
Thank you so much, Pak Andika. Very interesting, you know, like certified 1,721 hotel and restaurant. I think it makes the tourists become confident, you know, to do their activities in urban tourism in Jakarta, and you know, like exploring a unique collaboration even Cikini, you know, with the GXB, and then Pegi-Pegi, and of course with Accor. I think very nice, very nice initiative. And I think some of the candidate of investors that watching us at the moment, you can have the one-on-one meeting in the next day, in the November, the next day, to talk more about what Pak Andika has mentioned before. Okay, thank you, Pak Andika. Now I think I'm moving to Ibu Serlina and Bapak Adi Satria. I think it's about the current situation. Undoubtedly, pandemic COVID-19 has been affected, and of course, I think tourism sector is hit the most because of the COVID-19. And as one of the big cities in Southeast Asia with many fascinating facets, how is the current condition of the tourism sector in Jakarta, especially in recovery economic momentum at the moment? And how's your outlook, like in the next year, or would it be recovered, fully recovered in the next year or the next 2 years for the tourism sector? Ibu Serlina and Bapak Adi, please. Ibu Serlina first, please.
Okay. Thank you for the question, Mbak Hera. So actually, when the pandemic hit us really hard sometime in March 2020, there is really no playbook regionally and globally. I think on the price level of the antigen, PCR, and so on, and the tracking effort that is really made in place, we do notice that the improvement in the past 1 month, particularly for the Jakarta region and all over Indonesia, the number of cases has been the lowest, I guess, if I'm not mistaken, the lowest throughout the pandemic. So this is really a very good news for us, though we need to be really careful as well as being still optimistic. And how Pergi-Pergi navigate throughout all of this is that we collaborate with thousands of our hotels supply that is spread all over Indonesia, not only with the hotels partners, but also with airlines, but also with the bus providers, also with all partners, working in really ensuring that the pull and push for us to do things really in line with the government regulations, right? So we're really working very closely with the government. In case government say it is safe, then we will push. In case government say that, oh, we need, it's a level 3, level 4, then we will pull the trigger. So we will hold back, meaning. So that's why what we have did during all of this time is really to make sure that we work closely with all of the ecosystem players, with the government. We also have a dedicated curations for hotels, for example, in Pergi-Pergi, whereby the cleanliness, safety, health, environment, the CHSA, really, we bring that in place in a very solid within our platform. And the results is really quite satisfying, I'd say, because at the beginning of the pandemic, we have lots of hypotheses. All our players have lots of hypotheses. We have the hypothesis of whether the recovery will be U-shaped, meaning it's very slow, or whether it will be J-shaped or whatever kind of shape. But now we do notice that actually the Indonesian market are quite resilient, I think thankfully, optimistically, but we also need to be very careful in the next few years to come. Accommodation business, specifically in Indonesia, have hit the recovery rate of 50 to 60%, whereby for the flight business, I think it is still around 10 to 20% in Indonesia particularly. So we are very optimistic seeing the vaccination rate, seeing the entire procedures that the government has put in place, that the situation will get better from quarter to quarter and then for the next few years to come. But so long as we are really being very stringent to really making sure that when the protocol is there, we are really complying to the protocols on behalf of the industry players, and then on behalf of the citizens need to also do the same. But the way we see it, the trajectory is still promising, very promising in the next few quarters and few years to come. Thank you.
Thank you, Ibu Serlina. I think we do appreciate the government, what the government has done, to manage the COVID-19, especially about the vaccination and then about the implementation of health protocols. And I think it's good to hear that Pergi-Pergi is already collaborate with the thousands of business partner, like being a business enabler, in the current condition. And I like the sentence that you shared with us. Indonesia market is very resilient, very optimistic. Hopefully it will be the good signal for us. Now I move to Pak Adi. Pak Adi, are you that optimistic as well, like Ibu Serlina?
Look, for us, yes, absolutely, we're very optimistic, yet cautious. We need to ensure that all of the health protocol in our hotel obviously being adhered to with the app, with Peduli Lindungi, we need to ensure that's being utilized accordingly. We follow definitely, each time the announcement from the government, we're very active on that to ensure all the implementation on what we could do at the hotel level is being implemented accordingly. Definitely, if you have a look at it from early September, I think it was moving into second week of September, October, and now we're going into second week of November. Certainly the market has picked up. Obviously, we have a lot of help from the government spend for this period. So yeah, the results certainly going really well for us. Occupancy has gone up, and the market is there. It's true. Indonesia, one of the I would say benefit and advantage in Indonesia, the market is very resilient, and the domestic market is very, very strong. So for all of our hotel in Jakarta, they're enjoying a very good level of occupancy, and not only in Jakarta but throughout also Indonesia. But we always follow the obviously advice from the government to always very cautious in terms of the health protocol. It's very important because yes, while the vaccination rate is very high, which is very, very good for us in Jakarta especially, but at the same time, high vaccination rate, you could still get infected by the virus. So we remain very diligent on that front, and working closely with the Satgas COVID task force that we have available in every hotel to ensure all of the event, all of the activity within the hotel, it's according to the government regulation. Because the implementation is the key here. You know, if we could have that implemented close to 100%, that's very good. But as you know, we're being human being. You know, there's up and down. So there's also weaknesses that we need to be very cautious on that. So yes, the answer is yes, very optimistic, yet very cautious to ensure all of the application of the health protocol being adhered to in all of our hotel activity.
Yeah, Pak Adi, very optimistic yet conscious as well, and ensuring the condition. And of course, I think the data that you shared is very interesting. Early, from since the second week of September until the second week of November, it's you know, the market has picked up, and then one of the contributions comes from the government spending. Thank you for the government. And then the occupancy is getting up. I think it's a good signal as well. Even we have to mitigate and, you know, like anticipate for the risk amid the uncertainty of the virus, but hopefully the optimistic is still living there, you know, in the market. Now I think I'm going to Ibu Novita Dewi. Ibu Novita, from regionally owned enterprises or BUMD.
Okay, the answer?
Yeah.
Okay.
Okay.
Are you sure?
Yeah. Oh, I think Pak Adi is not muting the audio. I think Pak Adi is talking to me. Okay, now moving to Ibu Novita. Ibu Novita, from regionally owned enterprises or BUMD perspective, how is the strategic planning and insight to develop the local tourist destination, such as a culinary tourism, cultural places, and other open areas, and building assets? And if you talk about the hybrid events, and how you manage all of those things and giving the new concept of urban tourism in Jakarta, Ibu Novita.
Yeah. Firstly, as people prioritize the health aspect, we attempt to combine tourism packages with health services. For example, a tourist package including vaccination. We offer Jakarta's urban tourism package and a chance for the tourists to get vaccination. By doing this, we are not only benefiting the tourism sector, but we also encourage more people to get vaccination. And moreover, we also provide a wellness tour package that over people to get various relaxing activities such as spa, yoga, meditation, and health culinary tour. But however, the wellness and culinary industry have to comply, of course, with the health regulation to ensure the safety of their products. And then secondly, open areas and cultural places need to be activated. We also have so many potential cultural places in Jakarta. Yes, some are old and perhaps are not well maintained. So those we need to bring excitement to those places. we optimize those areas into productive activities. Well, 2 weeks ago, we held a Jackpreneur Fest in Museum Mandiri. Museum Mandiri is one of the historical places in Kota Tua, and we bring back the excitement to the Kota Tua by holding event in the area. And another great example on public area activation will be held on the end of this month. Collaborating with Jakarta government and private sector, we will have bazaar at Taman Fathahillah Kota Tua involving MSMEs of Jakarta. And the most important thing that we should do not forget is how we collaborate to make this happen. So I very agree with Ibu Sherlina. The revival of the tourism and creative economy cannot be achieved by only by one party. So every party has a significant role on developing the industry after the pandemic outbreak. Hopefully, by doing these strategies, the condition of Jakarta tourism is gradually improving.
Thank you, Ibu Novita. Not only talking about the tourism, but you're also talking about encouraging citizens, people to vaccinate. I think that's one of the key amid the COVID-19. And then very interesting, relaxing, and then culinary, and then of course significant roles from each parties to work together to develop, and then like to rebranding the new urban tourism of Jakarta. Thank you so much. Now I think I'm going back to Ibu Sherlina. It's very interesting because Pagi-Pagi is one of the apps that people using at the moment. From a private sector perspective, Ibu Sherlina, during the post-pandemic situation, how did digital e-commerce, especially in tourism sector, survive, and recovery strategy to improve the tourism sector from a business perspective, especially by following the global trend of the using of digital industry? Ibu Sherlina.
Okay. Thank you for the questions. When the pandemic hit us really hard back then in March 2020, we do gather all of the team, the management team, the entire team in the company, right? So then there are two major factors that we are noticing and we are seeing and we believe are the most important thing. The first is really to make sure that customers are number one. Second is really to make sure we put all of the efficiency efforts and measures in our company so that the company can sustain. Because when it hit us really hard, the business almost went to zero. And we cannot search for any playbook, be it nationally, regionally, or globally, of how we are going to face it. So we pulled the trigger on major two pillars. The first one is customer being the number one. There was a huge wave of refund back then. So almost all people in our company, across all teams, regardless of their team, we really make sure that the company is the first priority. Whatever that the customers need, we need to make sure that we can fulfill that. That's number one. The second is we pull the trigger to make sure that we put in the entire efficiency measures for the company. Because back then, what we believe is every spending that we do as a business needs to result in the ROI, right? So when there is no business, no demand, meaning there's no need to do a very significant spending. So that's why what we did is really streamlining all of the spending in all lines in the company to make sure that we can really be sustainable. Now, I think I can comfortably and confidently saying that we have came up of the pandemic really stronger, even have a stronger financial fundamentals. And talking about the recovery strategy, we have a three main strategy in place. The first one is to work closely with government and the entire players in the ecosystem, including the supply, mainly airlines, mainly hotels. Second is be very close to the customers, really understanding what is the pain points, what are the new needs in this new normal era. So we come up with several features. For example, we launched sometime in June or July 2020, we launched a clean and safety features within Pagi-Pagi platform. So what does that mean? In case people want to travel and want to stay in a certain accommodation, be it budget hotel, be it the high-tier hotels, upper to high-tier hotels, they can find all of the information that available in the safety, whether the hotels really have this CHSS certificate, whether They are really put in place the safety and health protocols, even including we put the pictures and the photos of the hotels there as well in our platform. So that is to really show how serious we are and in really making sure that we cater all of the needs from the customers. They are really the #1 priority for the company. And then thirdly is really leveraging the data-driven capability within the company to monitor where the demand is. Because prior to the pandemic, everything is so predictable. We can safely say that, for example, in case it's the end of year, then there's already a predicted certain destinations that are leading where the demand is. But during the pandemic, everything changed. Suddenly, we do not have any formula to tackle where the demand will go. So we really leverage the data-driven approach inside the company, which we leverage the big data and insights generations to make sure that as the demand recover, even at a very granular level, at a specific region level, we are able and ready to tackle that. So it can change on a weekly basis, it can change on a daily basis even, it can change on a quarterly basis, monthly basis. So we are ready to really tackle where the demand is. So in short, there are the three strategies that we are really holding up until today. The first is making sure that we collaborate very closely with government and all of the supply players. Second is be very close to the customers, know where the demand is, and really shift the entire our product strategy and product deliverables based on the needs in the new normal situations. Thirdly is to make sure that the data-driven approach is really being implemented even at a very granular level. So we can help the company recover, not only help the company recover, but at the end of the day also help the entire nation recover through the pandemic, because we know where the demand is and that is where our strategy and product offerings will go. So in short, that is the thing that we are implementing to make sure that we can recover fast on behalf of the nation as well. Thank you.
Ibu Serlina, so it's about return of investment, ROI talk about, and then if there's no demand, so business have to wait for a second. And there are three big steps or big points, like working closely with the players in ecosystem, with the government. We talk about collaboration, and then work closely with your customer, knowing the demands, and then leveraging data-driven capability. I think that three big points that PGPG has already implemented. Now I'm moving to Pak Adi. Pak Adi, are you doing the same thing, or is there any new initiative, especially for hotel, not only giving experience, not only hotel? Are you going to collaborate with, with the digital players at this moment, or do you have any kind of initiative that you're going to implement in the next year or the next 2-3 years, Pak Adi?
Certainly for us, definitely, as we always adapting with the situation and also with the different change that happens in the market. In fact, just before COVID pandemic, we just change, or we make a new adaptation on our loyalty program platform. Used to be called A Club or Le Club. Now it's we're moving to what we call a full experience implementation. That's why we said it's augmented hospitality for us. It's more than hotel stay. So we actually just did that just before COVID hits, right? And we had to stop. And now as the market comes back, we're continuing with our progress in terms of this innovation that we've done. So we're actually, as I mentioned earlier, we're working very closely with all of the stakeholders around the hotels to ensure we can bring that element of experience into our product, into our offering. And that's where the different brand now it comes into play. We're just about to launch a lifestyle brand experience. I could not mention it here yet, but next year we'll bring this new lifestyle brand to Indonesia, and this is the first launch that we would have in Southeast Asia. So it's very important year for us, 2022. Accor has always moved forward. Recently, we announced of our lifestyle division called Ennismore, and we work closely with different stakeholders throughout the world to bring this platform together. And we will continue to do so because it's within our DNA. And for Accor, it's about bringing added value for our owners also, our customer, our clients, and that's where we are. And digitalization, it's very crucial for us in all of our facets of business, from the front end in terms of facing the customer, right back to the back end in terms of our financial numbers. So certainly is for us, and we'll continue more. And we put a lot of, I would say, financial investment behind that throughout our investor, because we're a public listed company, and we'll continue to do so more.
Thank you so much, Pak Adi. Yeah, new lifestyle brand. It's going to be the first launch in Southeast Asia, and I think we'll be waiting for that next year. How is it going to be? And then giving added value. And of course, if I'm not mistaken, Ibu Serlina and Pak Adi talking about agility. So it can change like within a week, within a month. So we have to be ready as market players. Now I think I'm moving back to Bapak Andika. Bapak Andika, what Ibu Serlina and Pak Adi said is about the investment as well, talking about the demand. How is the potential of investment opportunities in tourism sector to be specific in the development of the area? Bapak, please.
Okay, all right. Talking about the potential investment opportunities in tourism sector, we have identified and improved several neighborhoods in the city that has significant characters, ranging from cultural heritage, culinary, shopping, and even natural biodiversity. In Kota Tua, we have a very valuable heritage assets. The architecture is very romantic and currently abandoned. The joint venture initiative that Ibu Novita said, it done between national government enterprises and city government enterprises, mean to rejuvenate the empty building with adaptive reuse strategies. Whilst in Cikini, we had the mixture between cultural center and culinary lifestyle district, right? We had improved the pedestrian amenities, accessibilities, and tailors the community stakeholders. And also Block M, the mini Tokyo of Jakarta, has reached a cultural community of Japan expats. The M Block also stands as the new youngsters lifestyle hub of the district. Last but not least, we have Kepulauan Seribu. Kepulauan Seribu has lots of interesting natural resources and breathtaking views, which located not far from the city. It is the hidden gem and the best marine tourism in Jakarta. Tourists can do various of water activities and also enjoy the local food. And for investment, in this case, Tourism and Creative Economy Department of Jakarta, together with Jakarta Investment Center, are open to help and guide you, the investors, to invest in the developing of tourism in Jakarta. Thank you, Hera.
Thank you so much, Pak Andika. Very interesting. The areas that you mentioned is, I love that areas as well, like Cikini, Blok M, and then Kepulauan Seribu, and all the investors, you have to visit because it's very beautiful. And I think the offering to guide you as investor to invest in Jakarta, I think you can to the next level, talk with the government as well on the one-on-one meeting. I think it's going to be very excited, yeah. Okay, now moving to Ibu Novita. Thank you, Pak Andika. Thank you so much. Ibu Novita, how is the current condition? As we know, probably from Pak Adi, from Pak Andika, from Ibu Serlina, they already shared. But according to your opinion, how is the current condition of the tourism sector during the pandemic situation, especially in promoting the international MICE industry as one of tourism potential business sectors? Ibu Novita.
Well, there are some changes in the tourism sector as the pandemic occurred. People prefer to hold virtual event as their home becomes the center of the various activities. And people also have a new interest in outdoor activities and prioritize health and sanitary aspect. But however, as COVID-19 case is going down and the social restriction is slowly relaxed, we are planning to hold more offline events with strict health protocols. COVID-19 still exists. Thus, we are going to compromise and adjust the activities so that the MICE industry can continue operate and the economy can recover. And for the international scale virtual event, we think that there will be no major issue as we have already done this many times. But however, to prioritize the safety of our citizens and to build our confidence to hold offline international event, we need to expand the vaccination reach, ensure to implement health protocols on every occasion and maintain the low cases of COVID-19. We need again to collaborate to create a safe and comfortable environment for the tourism industry. Thank you, Hera.
Thank you so much, Ibu Novita. I think we have a very limited time. If we make this discussion, if we're having more time, I think it's going to be more interesting. But thank you so much to all my panelists. I have Pak Andika Permata, I have Ibu Serlina Wijaya, Bapak Adi Satria, and Ibu Novita Dewi. Very interesting. And let me give a very short summary. Some of the keywords, key takeaways that you have already shared with us on your presentation, on your answers. I think COVID-19 is a game changer to all of us, not only for Indonesia, Jakarta, globally. It's a game changer. So I think this is how we're gaining momentum of the economy recovery by collaboration and agility among stakeholders to build the new branding or the rebranding of urban tourism of Jakarta. And I think if it can implement it very well and COVID-19 rates and vaccination well managed by the government, I think it's time for us, to recover and to enjoy Jakarta. And hopefully all the investors, you can do the one-on-one meeting one more time. I remind you because it's very interesting, very potential. Jakarta, the biggest city in the southern hemisphere, and of course with the high purchasing power, trust me, you won't feel sorry for this. Come to Jakarta. And then before closing this event, I would like to remind all the participants to redeem the voucher on the email registration. And by this last session of plenary discussion, I'm Hera F. Harin, would like to inform that Jakarta Investment Forum 2021 is not over yet. On 15th of November 2021, we still have a special agenda, Meet the Leaders, where all of us are got a chance to have direct conversation about investment and policies in Jakarta. For further information, kindly visit the website www.jakartainvestmentforum.com, and this event is initiated by Department of Investment and Integrated One-Stop Services of DKI Jakarta and Jakarta Investment Center in collaboration with Bank Indonesia, Agung Sedayu Group, PT Bank Sentral Asia Tbk, Pakuwon Group, Putra Gaya Wahana. And I think that's all for today. And then Indonesia MRT and Indonesia MRT Jakarta, and then Rose Indonesia. Oh, I think the way to spell Rose Indonesia. I'm afraid I mistake to pronounce it. And then MRT Jakarta, an experience by Jakarta Experience Board. And thank you all participants for joining the Jakarta Investment Forum 2021. Stay healthy, everyone. See you and bye.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sri Haryati, Assistant for Economic and Finance of Jakarta Provincial Government. Jakarta City strives to be proactive in overcoming the post-pandemic situation. With the well handling of COVID-19 and economic coordination that progressively recovering, Jakarta is open for many investment initiatives in the sustainability field of tourism, mobility, and health. Let's invest in Jakarta and see you at the next Jakarta Investment Forum 2022.
Through Jakarta Investment Forum 2021, we see a lot of favorable chances for all of us to discuss and contribute for a better city development. I would like to thank all of you for participating in this initiative and see you on the next Jakarta Investment Forum.
Jakarta Investment Forum offers a lot of golden opportunities for us to discuss, and we are delighted to answer your inquiries about available promising projects on this event. I, Beni Agus Chandra, Head of Department for Investment and Integrated One-Stop Service, would like to sincerely thank all of you for participating and see you on the next Jakarta Investment Forum 2020.
It's an honor for us to present Jakarta Investment Forum 2021 to you. I hope we can cooperate to ensure sustainable infrastructure development. We hope you get all of the information you need. I, Deniwayu Haryanto, Deputy Head of Department for Investment and Integrated One-Stop Services, see you on the next Jakarta Investment Forum 2022.
Jakarta Provincial Government is committed to develop a livable city, and through Jakarta Investment Forum, we present to you well-curated project to shape the city together. We hope to collaborate with you, creating a better experience in Jakarta. Andika Permata, Head of Department for Tourism and Creative Economy. See you on the next Jakarta Investment Forum.
Assalamualaikum warahmatullahi wabarakatuh. Jakarta Investment Forum 2021 is a global platform for engagement and dialogue on emerging key issues related to Jakarta Sustainable Development. I am Ahmad Riza Patria, Deputy Governor of Jakarta, would like to thank you for taking part in reshaping Jakarta's economy. See you on the next Jakarta Investment Forum. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.